shift the schedule a little bit, but we're going to need a time in the afternoon. So the next panel will be around paid earned media strategies, how to engage the Spanish speaking media, build the communities. So I'm going to present it. It's going to kick us off.
I got you.
Yes.
I'm sorry, that's on me. So my panelists that I have here, they can join me and we'll do introductions up here. This primero, my VAPs first. Alrighty, so we'll get started. I was looking for the panel description. I think it's pretty straightforward. What we want to share with you all today is, and I know, you know, it's not here, but I was going to give a round of applause to Octavio, but I know we wanted to get a sense from you all, like, Octavio makes the very difficult seem very easy sometimes. And so we're like, hey, Octavio, can we do this? And he's like, okay. that was this good meeting for Octavio. And so I know he was very big on making sure that as we collect information on what were the panel conversations we wanted to have, that we were having the conversations that you all wanted to hear, right? The information that you all wanted to hear. And so what we heard from you all is that you wanted to learn a little bit more about paid and earned media strategies. We know we work with you all in different ways, right, in your region. Some of you all had your own strategies going on at the same time. But we wanted to kind of fill you in on some of the work that we did, right, at the state level. And I wanted to bring in some of the experts that we got to work with. That's just a huge pleasure to work with that have their very own styles of kind of doing this work, have been doing this work for quite some time, and really just share with you their wealth of knowledge on how they do this work. As most of you all know, with earned media specifically, there's almost like no perfect formula, right? It's like relationship based, but then it's also story based, but then it's also staying in communication. It's just very different, right? And so we wanted to share all of our learnings with you all. On the digital space, a lot of you asked, okay, what is all this lead generation? What does that mean? How do you look at it? What we did for this campaign in terms of digital media was way beyond anything I had even done on communications work. And so we have the expert here to talk to us a little bit about that. And so that's what we're going to talk about here in this panel. We might go a little bit over based on the agenda you all have, but we have a lot of wiggle room to work with. Similar to the previous panel, if folks have any questions, please feel free to bring a post-it note over to me. Raise your hand. We're amongst friends, right, for this work. And so with that, I wanted to get us started with introductions. I think a lot of the folks that I have on the panel almost need no introduction, right? But I want you to hear from them how they came to this work, right? Whether it be paid media, earned media, the media that they do. We have with us Dr. Ilan Shapiro, as folks our chief medical correspondent at Altamed, what is very well known in media. It's almost, it's so funny because someone called me from my family the other day and they were like, I see now, because they told me like, hey, can you ask this question to Dr. Shapiro? And I was like, sure. And they're like, and now on my Facebook feed, all my videos are Dr. Shapiro. I was like, you told the algorithm something, right? And so, but folks might think that he has like a team of like 10 communications professionals. He doesn't. This is all Dr. Shapiro, so I wanted to share a little bit about that. And then we also have my colleague, Cristina Sanchez, who is our Vice President of Public Affairs. A friend of mine for, over 10 years? Yeah. I would barely like 12. But we did a lot of campaign work together on the civic engagement front. So I was just really excited to learn that as I came on board at Ultimate that I would be working with her again because it's such a treat. You learn so much every day as you work with Christina. So I wanted her to share her knowledge here. And then we have Carlos, who works with Project West Media. I always get it switching around, but Carlos was really kind of the mastermind behind a lot of the lead generation work that we did on our digital ad boards. Talking to Carlos, it's like, you're like, wait, you can do that? And he's like, oh yeah, you create a lookalike audience and then you put in the zip code and then you geofence them. And I'm like, okay, wait. And so what took us to new heights for this campaign was really just kind of having these conversations with Carlos, right? And as I would talk to Christina, I'm like, we have to bring this to the sub-ranking. We have to tell them about it. And so I'm really excited to have them all. That's my informal introduction of all three. And so now I'll give them the mic for them to give us their formal introduction and their experience with paid and earned media. And we'll start off with Dr. Shapiro.
I can't really go beyond my mother. That's fine. I go for my associate, go next associate, and I have the pleasure also to come to the US. As you know, the 5 most important Mexican incorporated cities are associated, Los Angeles, Guadalajara, Monterrey, and are actually not in Mexico, but still generate a lot of the culture, influence, and money to the country. That I need to decide where you go there. For you know, but I'm already moving to it. I started actually with H1N1 that. I was a medical resident in Chicago. We had very similar things that we're having to do right now. And there was a piece of, there was a lot of the doctors that were out there. We're selling vitamins, they were selling, fear, they were selling absolutely anything that was not helpful for our community. And I started seeing the same thing. When we get vaccinated, because the vaccine gets tardy, I started to bring all these messages around, H1N1, the US of 2009. And when we started working, the most important thing is being present. Who likes to be in TV? Who would like to be in TV? Be honest, you can go there. Who likes to write stuff? Okay, we have a couple. Who likes to write stuff? Who would love to be a radio? Who uses Instagram, Facebook, Twitter? Okay, then right. The important thing that I understood very on is that I wanted to message right community fast. First of all, I needed to get the voice because seeing 100,000 pages a day was not factual or positive for me. And I needed to figure out a way that with this type of lead generation, with talking with media, and actually setting them heads. I call them, I always tell edits and any reporters that I'm going to give them heads. Because I try to be on top of some of them, and by on top of them, I mean, this is the message of the day. This is what's happening. This is what I love. Tell them what to do, but this is what the community actually needs to do here. And we mentioned right now 5 tools. We heard about radio, TV, social media, and other video stuff. And choose whatever you want. We already saw the power that we have. And the other thing that we did well, this is actually for us, is that we didn't empower each other. But this one right now, Boeing is coming, and we need to repose our things. We tried to do it on the instrument and we were part of it, that we were doing that way. We were very good at the beginning, but things happened and so we need to be very big and actually this. Make sure that talk to your reporters, to the local radio station. They want the story about La Productora, they want the story about who the hell, is creating access to the community. They want to hear what good and bad things are. We don't sell it, we don't use it.
Buenas tardes. It's such a pleasure to be here. Thank you, Dr. Shapiro. I've learned so much from you. I'm Cristina Sanchez. I've worked with some of you in some capacity. I was born in a small town called Pacoima, California, and was taken to Mexico. My father did reverse immigration, was not happy with the quality of education, everything he was seeing. So I actually grew up in the small city of Mexico City, came back when I was 12 years old. The only difference, I do have the immigrant experience because I only knew Spanish. I was 12 years old, but I felt like an immigrant, and I felt I was bullied. I was called a wetback. I was called everything, and I knew I had to learn the language very quickly. Fast forward, I went to school there, and I started in television in 1989. And I like to say how long I've been in this medium. How many census cycles have I been through? Many, by the way, because it's always been about information for my community. What I learned working, number one, for a small independent television station, which was KWHY back then, KWHY, is that you could do anything on television. And I was in charge of public affairs. I learned that our community trusts television. Not so much anymore, by the way, because it's changed quite a bit. And you have personalities versus journalists, etc. But I can tell you, as I moved to Univision, it was that one phone call at 7 o'clock, because I was literally the director of public affairs, but I felt like a social worker, because it was that one phone call. It's like, this is Cristina, and I would hear, oiga, ¿qué pasó, señora? Soy María Pérez, vivo en tal ciudad y me van a desalojar de mi casa, ¿qué hago? Those are the calls that I would get, by the way. Every single day, our community, our people would call Univision because they were in a crisis one way or the other. And I want to be brought to tears because you develop such a relationship. I can't tell you how many children I was asked to baptize by our community members because it was Cristina Sanchez who helped me out. Working there, I realized the power that we had to be able to get that information in the hands of our people. And it wasn't so much just reporting a balanced story, it was advocating for them as well. So we went knee deep, and this is where Elisa comes in, and we did work on a couple of campaigns. It was Ya es hora, ciudadanía. This is when the TPS was running out. This is when the citizenship process was going to be increased, and we needed to be rapid response, get our community to respond. So I have the privilege of coming from television, Spanish language, and this is how I got to Altamid. I got to work with them from the clinic up, because when I needed information on prenatal care, diabetes, heart disease, it was my doctors at Altamid that I would go to. And I'm proud to say that it was at the clinic level that I got to know the organization. I would never think in my wildest dreams that I would be working for a health community center, but my passion is there. I feel like I have the knowledge, and I came in, my first month was, we have this little campaign that we want to launch for vaccines, and I'm like, okay, and a month later, Lisa came in, and Berenice was spearheading, and Gloria, and Rosa, I'm like, yeah, so arriba las mujeres, by the way.
For inviting me to the panel. My name is Carlos Gonzalez. I was born in Santa Monica, and I actually spent a lot of time in Mexico as well. My dad lived in Mexico, and so I would visit him every single summer from the age of like 4 all the way through college. So I kind of feel like I grew up here and there. So I feel that perspective. That's helped me a lot working in marketing and advertising. So I actually started off working at an ad agency in Santa Monica called Anita Santiago Advertising. And I actually didn't know what I wanted to do in college. I got accepted to UCLA as an aerospace engineer. But then I started doing some of the math classes, and I was able to do it. I just didn't like it. So I got lucky. I found an internship there at that ad agency, and I immediately just fell in love with it. You know, with marketing and advertising, and just the fact of being able to get out information to people. You know, tell them about things and products. You know, so I've been in advertising for about 20 years now, and you know, kind of have seen the evolution from broadcast and radio and now social media. And I think one of the biggest differences is that it kind of democratized the communication channel, right? So before it was like just one way. Let's get this information out on the radio and on TV. But there was no feedback, rarely coming back unless someone was calling to complain. They would call the TV station, hey, why'd you put that on the air, right? So I think now one of the most important things to realize is that people want a conversation. They don't want you to just put out information. They want to be able to comment, to talk back to have a messenger conversation, to be able to ask questions. They may not be ready to commit to whatever you're offering right away. They want to be able to, you know, have a conversation and talk about it. So, you know, this campaign was a great opportunity to do that. You know, we also run the call center, and with the call center, I think one of the things that we told everyone was it's very important to treat everyone as if they were one of your family members, right? they have questions, answer the questions, take them through the process. Don't assume that they're right away ready to get vaccinated. So I think it's been a really great opportunity to be there for the community and just provide information and help them get their vaccinations.
It feels like I'm just someone's friend, like we just need like the micheladas there. So like, yeah, after hours. It can't be on first hours. So I have a couple of questions for folks. You know, I'll share, you know, I'm actually a communications major myself. Somehow I got led into politics, but my background is communications. And I think one of the things that I found most kind of interesting and difficult in this, in kind of the space of communicating, right, is that when something happens, we take the information in, right? Like a new development on the vaccine, or you take the information in, and even on the, you know, on the, you know, something happened with the election or whatever, you take it in, and then you kind of become like emotional, right? You're like, I don't know what to do with this. Like I have this information, and I feel a certain way about it, and then I don't know what to do with it, but I want to tell everybody about it. And I realized that it almost just takes like that, like first step of doing the thing, right? Sending that tweet, of looking up that article, posting it, texting it to your friends, right? Whatever it may be. And I think, Dr. Shapiro, where you really thrive is like, you grab the bull by the horns, right? And you're just like, I'm gonna go and talk about it, and I'm gonna put out a video. I always tell him I don't know when he sleeps, right? Because there's always like new video, new content. And that you don't often see that also with like healthcare providers, right? And seeing your doctor constantly talk about all these issues. There's sometimes that I get my healthcare information from this. So I was like, what did Dr. Shapiro say about this? Where did that idea come from? What's usually your process like? And I know you build an audience, right? How did you build that audience as well on social media?
I'm going to tell you to come and please try and everybody has a little flavor. You will see it. I find myself a couple of things that I will be always honest. I will publish things that will be helpful. If I, you know, what's on the other side, that will be helpful. And you have heard me say this immediately, right? I just like getting the patient to Spanish. That's my philosophy. That I break down and she has to make sure that our community has some type of information within your head that will be helpful. You'll do that every day in your life. For me, you know, it was easier to start with social media than with general media, because that way, you know, I got a couple of ideas, and by the way, you will work a lot of these things. And it comes a lot of the part of making sure that your team and your company and your team will everybody survive. One of the beautiful things is that you start small, after that you start being more flexible. One of the things that we have here about BC, like I said, and even a big team of a lot of things that I do is that, you know, we have built up. I do not believe my post, I promise, but I did a lot of mistakes at the beginning where, you know, the information changed and someone actually asked me something and you know how to answer that. You know, you're trying to really know. The other thing is, I really, it sounds weird, but my idea is I put it out there, I do the hashtag, that's very important. And I do have like lists on the back page, and you run who it's also one that actually manages the social media in a Keynote, but who actually manages the Keynote social media this year? Okay. Again, I will run it with this on the computer with this on the back. The guest here is getting the leaders actually have their own personal Instagram stuff. I should grab it and actually retweet what we said. Because it's awesome when we said that when we see that we're trying all the time, these are amazing in Twitter, and we send out our stuff, but it's not for us. We already know what we want, right? You disseminate it and actually share it more. That's what the other one is in partnerships. There's some beautiful map over there. That place is for California, and all of these 5 beautiful clinics are part of it. Build communication. Bring your nurses to the Instagram stuff. Bring your stuff. That way, you know, and your patients also. Because we're all part of this, and if you don't do the same thing, you know. the last question that said asked is, make sure that my concentration is what. I never know where the trends go, not because I actually have like a beautiful, like a machine and they send me the word, and they feel like the content coming home, it's coming from. I don't have. Yeah, that was I don't have a reasonable thought. There's trends, and you start checking the trends, and you see the article, and you start increasing the trends. Then you get that, for example, right now, today, or weekend, it's going to be stuff. And then share with you my information and walk through this message, example of how we prepare it's a beautiful vaccine. We had 60 cases in the US, more than 80 million people actually received the vaccine. The CDC, because we have 3 vaccines, and in this country, we have the luxury to choose one luxury to choose 2 words. Luxury to choose what vaccine we have. That's why we have to do better off by using her, right? Then Pfizer and Moderna are on the same level, luxury to choose them right now. You start hearing from the news that this is horrible, I'm very afraid of Johnson & Johnson. In Mexico, you don't have protection. Here, you want Johnson & Johnson to be still effective. But the messaging will be on the serious side. Okay. I'm going to bring my comment to make sure that people have the tools to make sure that their family and them are not sure. They choose to trust the vaccine. That's on them. If they choose to actually get the vaccine on the phase that actually needs to be worked that I will celebrate. But I will never get to do it. Right? That's part of the work that we need to do.
Thank you. So the kind of pattern that we've had, right, both with, or the trend with the campaign across the board, right, is really attacking something that we, which is COVID-19 that none of us had ever experienced, right, with also the non-traditional, right? And so we talked about, in the earlier panel about this sense of community health workers as these, as skilled workers in tackling healthcare issues, right? What we also want folks to think about is the non-traditional in this space. Oftentimes, and my mom was creating this because my mom just got into Facebook and she's really into Facebook. Like she types everyone. Yeah, she types everyone. And that just reminds me that part of this type of work that our media work is, those are just kind of fancy words for storytelling. That's what we're doing. We're storytellers, right? And all of us can be storytellers, whether it's, mandé un mensaje a WhatsApp a todos a mis 50 amigos sobre la vacuna, o el video del doctor Shapiro se lo mandé. You are telling a story for people and you are part of this bigger work, right? So even though, not all of us will manage the social media platforms or even do media interviews, think about what story you're going to tell, right? Because in that way, then you all become communicators in a non-traditional way. And part of that non-traditional way is the work that we do with Spanish language media. It's so interesting because again, when I was working at my previous organization, I would get invited to all these conferences and panels to talk about like, what is the formula on working with Spanish language media? And I'm like, be kind, like that relationships, I'm like, I go to producers like kids' birthday parties, and it is very much based on that culture. We've been talking about culture, all morning. And so I wanted to ask Cristina specifically that question, right? Because when Cristina and I met to work on the Yes Hora campaign, which was kind of a family affair for my brother was also working on the campaign. And I was just like, I love hanging out with Cristina, right? Like it's just, you build this relationship, but then when it's work time, you kind of brainstorm on what are the ideas, what are the stories. And the difference that I saw between sending out a media advisory and then doing a bunch of advice was that we co-created content. We came up with the stories. We came up with what are the things that are important to the community right now, right? And so Christina, from your experience, I want you to share with folks a little bit about how it's different working with Spanish language media. What are some best practices? What are things that that folks can be doing to develop those relationships with reporters, with the outlets, you know, from your previous experience?
I think it's important to realize that news as we knew it, was television, early morning, 6 p.m., 11, that was traditional news. Now it's 24/7. Remember CNN when that was born? Anywhere stream, you want to Apple News, you said it, what you want to hear. Derby, NFL, etc. I think if we go back to traditional news, it still is very relevant because people still tune in. It has live beyond the 5 o'clock newscast. It has live digitally, it gets reposted, etc. It's important to know how news is produced. Remember that if you're the producer, the writer, the person who's running the Chiron, etc., they have to look for stories. So in the morning, the first thing you'll sit down and read the newspapers. Many times the leads are from the newspapers. What's going on? What do we see? New variants. At raids at Vallarta supermarkets, whatever it may be. Then the reporters start to pitch. But that's all relationship based, because by then, the set will have called, Julio Cesar, and said, we have this and this today, and he'll have it on his radar if he pitches it. So you have to remember that reporters, yes, they play a great role and you have a relationship with them, but many times the stories get assigned to them. Today, it's, you know, the child was lost in the drowning, etc. There's summer stuff we need to cover this. And many times, Spanish language is very different because they look at it from the lens of how is this going to help my community. You have to remember they tend to be really amarillistas too. No doubt Spanish language is really good at that. That's why we have the impacto and local people, because those stories are extreme and they do very, very well. They will cover crime, they will cover tragedies because it is news and it is happening. And just because they don't cover it doesn't mean it's not happening. So again, many times you don't want to see some of that stuff, but it is happening. And you can tailor what you want to see. A story like this is bringing the story of our veteran program, of Don Epifanio, who sells tacos and also helps people with rent assistance and with vaccines. That's the difference. The stories that we come up with, and all of you, and I mean, I know some of you have relationships with them, it's just know the people, at least, you know the cycle, okay? Many times, I don't go straight to the person who's writing it, so it's wrong. I go straight to the person who's hitting the button, because I want to make sure they get the phone number up. I mean, that's how granular you can get, but it's important to know kind of the news cycles. Monday, Tuesday, best day to get information out. Fridays, that day, their best conference. Saturday, Sundays, we have club, you have your E-team, not your reporters are not working, holidays, sweeps in television, for example. Sweeps is when they need the highest ratings so they can set up their advertising rates. So I remember sitting, I was not a news producer, but I would sit in the news department because I have stories. I work with every single nonprofit there and would know what everybody was doing to pitch those stories. And they were amenable to giving them up. Sometimes they were not. But during sweeps, you'll always hear, and I'll never forget the story, John remembers, it's like, la sopa puede causarle daño a las 11, más noticias. Well, it was, if you made it too hot, it was going to burn you. And it just tells me that people are like, that's the end of that. That's so hot. So that's a really good cycle of news. Yes. We can go on stories, and sometimes you're like, really, that was a story. The relationships matter. Know what campaigns they're working on. Know what's a priority for them. Women's Health Month, Mother's Day, vaccines, GOTV. Incorporate your stories with people into that, and also give money to put into sort of minimize leverage. I do this much, run so many spots, but I want to cover my news. They're not going to commit to it ever because it's supposed to be church and state, but many times they will give them those stories.
That's great. Memories on you know, but all key important things again when we say, you know, who's the storyteller, who does this work? We can all do this work because it really is about those relationships and having those stories and the human interest stories, like those are gold, right? the knowing the person that, I mean, when we used to do voter engagement efforts, we would get like, okay, well, I want you, that first time voter, right? Just became a naturalized citizen, primera vez que va a votar. We want to follow him like from when they wake up to like when they go to the polls, why is he voting? And then I remember doing a story where it was 3 generations of voters. They wanted multi-generation voters. And I was like, man, that's a hard ask. This was CNN in Espanol. And I was like, I mean, my abuelita, my dad, and my nephew. And they're like, good, we'll be there at 3. And I was like, all right. So we set up the living room. And so thinking about those stories, like what would you want to see, right? What would you want to hear? All of that is really important because, like we said, we come from the communities that we serve. So we are the target audience. So you are the best storyteller, right? And so now I want to move us over to Carlos. I think, a lot of the social media work that we talked about and a lot of the work that maybe you all didn't see, right? You got to see the graphics or maybe you were served an ad. It took a lot of conversations, right? It took a lot of kind of background work, even that like 30-second like video that you would see that would, repeat itself, et cetera, was testing, right? There's a lot of testing that was done. And so what I want you to share with us, Carlos, is a little bit about, one, the work that you all did with A/B testing, right, for social media. And I know it sounds like, we do that, what is that? And how folks can do it at a smaller scale, right? Because there's really, when you kind of dive into social media initially, it's really scary, right? And it's very like, I don't know what A/B testing is and a lookalike audience and geofencing, what is all that? But there is smaller scale tests that folks can run and things that folks can do to do some of this work where you can test out what are the messages that work. So if you can share with us, Carlos, a little bit about what you all did and maybe just some ideas for folks to consider.
So if I get too like some of the terms I use, please tell me. Okay. So I think, like you mentioned, is that one of the important things is always to test. And what does that mean? So, and also wanted to clarify that we're talking specifically about paid advertising on, let's say, Facebook and Instagram. So, you have your Facebook page with your organic posts and information you may be putting up on there, which is different from putting up an ad on the Facebook Ads Manager, which is it can be a static image, it can be a video, slideshow of images, and usually that ad has some kind of call to action. So in this case on the campaign, we actually started with lead generation ads, which is an ad that you click, a little form pops up, and it's your name is pre-filled, your phone number is pre-filled, and your email address is pre-filled. And then click submit, and that will go to the call center, and then the call person back, text them, and start the process. So in that process, I mean, I think at the beginning, we started with static images. And one of the things we learned over time was that videos work better, which we kind of knew from some of the other campaigns we were doing. But very specifically, we learned that vertical videos are better and really short vertical videos do the best. So we're talking like 9 seconds. That seems to be the sweet spot. And in those 9 seconds, you really only have like 3 scenes, right? So what's the hook, and then what are you offering, and then a call to action. And that formula there at the end here seems to have been the best performing. So when it comes to testing, I mean, I know it kind of maybe sounds a little bit like overwhelming, but it's pretty simple because what you do is just come up with like 4 ads that you think might work. And I stress might because you never know what the audience is going to like. What you think is going to work sometimes doesn't. It's something you thought was going to work, and actually people responded to it, and that was the best performing. And so the next thing is that you have to make sure you're checking the results. So how many leads came in? I mean, the metrics are there on Facebook. How many conversations got started on Facebook Messenger? That's on there as well. So you have to constantly be looking at that and see what's resulting from these ads. And then over time, you'll start seeing this ad is performing better. What is this ad about? Can we do more like it? Let's do variations on this ad. And that's literally how you do it. You just start kind of like pulling a little bit, like this is working, let's do more, and then you do more like that. And then after a while, they stop working, and you have to kind of start over, like what's the message now? And recently, we had to change the messaging more to talking about the boosters because that's like the largest group of people that hasn't, taken action on it. Well, there's a large group of people that haven't gotten their first booster or second booster. So when we change that message, we started seeing a lot more results as well. So I think it's just really important to always realize that you may not know what's going to work, and you have to keep an eye on the numbers, and then also be willing to have conversations with people like you mentioned earlier, and they mentioned in the previous panel. It can't be just like a one-way thing. You have to be open to, doing Facebook Messenger ads where people will send you a message and you kind of go back and forth with them. I mean, doing that is like gold, really, because there's, you can't really do that on a massive scale. It's like if you do it at a community level, at a smaller level, it's really good because you can't have one-to-one conversations with potential patients or people that, need your services or need your help. So I think,
Now we know. Just so, so hopeful, and I think, again, the message here is like, there's really like not that secret formula. There's not this package that we're gonna give folks to say, run this and we're gonna do all the work, right? I think it's really appealing to the community, understanding the community, and then being open to trying and failing, right? Trial and error. And when we talk about advice, we're also not talking about like, hey, grab a $100,000 budget and just, that's a lot for some folks. Start out with $100 to do a couple of boosts, try things out, right? There's definitely kind of smaller scale campaigns, even in your organic social media, right? Try out what works. And I think the other piece here that I kind of want to, go back to the panel on is that, and I talked about this a little bit earlier, is the sense of all of us being storytellers, right? And one of the things that I learned early on in kind of doing the civic engagement work and the community work is that we're all a brand of sorts, right? Once you get on social media, you're kind of a brand, right? I know that if, that if I go on Better social media, I'm gonna know what she's doing at the state capitol, so I'm gonna be following it. If I go on Dr. Shapiro's, I'm gonna know what's going on with healthcare. Those are brands, right? And so it's really important to understand that we as individuals can do that. You don't have to be an expert in any of this. You can try things out, you can explore, and creativity is really at the core for this work, right? Just creating these partnerships, et cetera, and just trying things out, being innovative with it. And so I wanted to go on that point, I wanted to go back to Dr. Shapiro to talk a little, let's say I'm someone, yo soy una promotora y estoy en Facebook, empezando mi Instagram, y quiero comunicarle a las personas con las que he hablado en la comunidad sobre qué es lo que está pasando, en qué estoy trabajando sobre los temas de cuidado médico, de justicia social, etcétera. ¿Dónde empiezo con mi creando mi brand, ¿no? Que hablamos. ¿Es un video? ¿Es agarrando followers? ¿Dónde empiezo? ¿Cuál es step one?
Step one. You need to choose who you are. And that's what you said here, that she's an amazing promotora. She has been in the community for 20 years. She knows absolutely everybody, and she's not going to. And he said at that point, she was like, well, I'm over this. Don't be afraid. There's nothing to be. Unless you send me weird messaging. Each of you inside a basket. We have people like, well, what? I have only 20 followers. That's 20 people that are here. And those 20 actually be one more that's 40 a week. And after that, that's 80. So like, I didn't know that. Don't worry about the number who comes here. Here's how it works. You don't go back to the same doctor because he's a doctor. You go back to him because he knows what he gave a share, or he or she gave a space and you work at much. The same thing with the doctor. Then they will go back with you. Make sure that your content is something that you love and you're proud of. A lot of people will do the funny videos, and I try to say okay, I have a 1 to 4 ratio, meaning that I cannot do many funny videos because that's not me. I do, that's okay, then everybody needs to have like their own menu of things that will make them happy. Then don't worry yourself. Have fun. That's the, and Instagram social media is like a job. You need to put time on it. You need to put an effort. It's not that, oh, I have an idea. Let me post it. Like, no. Especially if you say that when I was told you make sure that the community is understanding right now, just like us, this is something new. And all we ask, but this will be helpful for you for next week. Then she knows that Jonathan is like, it's still an option, and we do, that's what I think. You know, she's creating a graphic, Canva is one of the best tools ever. Then she Canva is actually more expensive. You go there, she can design it, and she has like a little, and this is what I'm talking about tools. When I'm going to use this post, you will see it probably. Or on Sunday, I'm going to actually do this. I'm afraid of the jobs and jobs of backs. And I'm going to use that book and bring them to the conversation. And the conversation is now probably. Spoiler alert, and the idea of that is to make sure that everybody gets into it with whatever you're experiencing. So that's the message of I'm afraid, I can't, I'm not those people that. And I'm going to use that part instead of I will actually have that and put it on the message. And please feel free to produce what I'm saying right now. I don't have any trademarks or anything like that. Please grab that idea. You have the book, you have the message, and the help is just get lost. Choose. We have three. They're awesome. And that way, we said our classroom will continue doing this. Create a schedule. Maybe at the beginning, we can have you for Monday to Sunday, for example, for me. I think I can post on Saturdays and Sundays. Whenever you see program on Saturdays and Sundays, it's a program. I actually program it beforehand. And the other thing is, one of the beautiful things that I have a lot of conversations, the bad things that I have a lot of conversations. Then I get a lot of trolls, a lot of the things that we have done for HHA, my house, Ándale, Qué Esperas, you can get feedback. It's true, people who don't have, that filter, but I mean, most of the people who actually read it will be very, very happy. Whatever message you set up or whatever message make sure that you have that hook, get a message, and for sure, very nice Canada. That's the three things that you should do.
Another thing to think about, and I always tell folks, like, a lot of what I've done is really just crazy ideas, and they will work sometimes, right? Not all the time, sometimes. And one of those things too is for folks to think about, right? Because we're talking about both like digital and like earned media, and we'll get into paid in just a bit. Is how do they all speak to each other as well, right? So, for my team, as we were doing GOTV work, at some point during the Ándale, Qué Esperas effort. And there was a video that we grabbed from the California Secretary of State, right, where we just talked about, like, here's the ways that you can vote. Very brief, 30 seconds, right? And I'm like, we don't need to reproduce this. Put it into the texting platform. Let's send it out, right? Because they're going to watch it. It's 30 seconds, right? The other thing on videos is making sure that if you are producing, even if you're not producing professional, like this, Facebook will do this for you now, is having the captions. How many of us are sometimes in, I don't want to say this, but I am, in kind of boring meetings, right? You're looking down at your phone and you're like, oh, they think you're checking email. It's like this really cool video. You're seeing what they're saying, but you can't hear it because you're in a meeting. And so one of the things that I learned in doing communications work is that folks actually need the captions, right? And so having those available is very helpful. Then we would grab that video and we would post it on social, right? Facebook, Instagram, tweet it out. When we would tweet it out, we would tag all of our reporter friends, right? Hey, if you need information on how to vote, here's information from the Secretary of State. And also, I'm available to answer your questions around voting, right? And so think about not reinventing the wheel, really a low bar of entry for this work, right? Like, you're all busy, you're doing the work in the community. You're not gonna have time to sit down for 3 hours and send all those tweets, right? And then your audience is an important one, right? Because, you know, I remember I did a training for promotoras once, and they're like, nosotros queremos saber cómo usar Twitter. And I was like, okay, Twitter es importante, pero ¿quién está en Twitter? No, like policymakers are on Twitter, right? Reporters are on Twitter. So do you want to target those folks on Twitter? General community will be more on Facebook, right? And so they developed their content calendar, right, in Espanol, and just kind of, they were doing these 30-second videos in the community. But you can target different, right? And so the other piece is how do you get all these videos and have them live in those spaces where you can target reporters, right? Where reporters know, si tengo preguntas sobre esto, voy con Fátima, right? I already know she already posted the video. I already kind of heard what the message is because she posted the video. I'm just gonna call her, we'll follow up, and that's it, right? So think about it creatively. Again, no secret sauce here. It's really just trying things out. Now, on paid media. And I think this is where I know I'm working with a lot of organizations myself. And I remember during the census work, some organizations reached out to me and saying, we got a budget approved for $10,000 for paid media. And I'm like, great, cool, right? Like, so what's your plan? And they're like, I have no idea. I don't even know where to start. Like, am I supposed to, do I just cold call radio stations? Do I just go to the TV station, right? Which is usually the number one for a lot of folks who haven't done it. And so I would kind of take them through the process, right? Like, who's your audience? Who's your, in my limited knowledge, because I also didn't know. So for Cristina, I'm Lisa La Promotora from an organization that just got $10,000 approved to invest in, specifically in language, right? In Spanish, to reach my community. Where do I start planning my paid media?
That's a very good question. We said many times, we have ad agencies that are super analytical and will tell you what each emails from Santa Monica, where this, they'll geo-target, and you know exactly what to do. You have to first of all know your audience. And yes, you can cold call, but for the most part, know your market, and $10,000 is not a lot. Television is going to be your most expensive. Honestly, stay away from television, okay? That's for the bigger budgets if you want to rotate. Think radio, and then think your most popular ones, okay? And then think that if you look at media conglomerates now, it's who owns the digital platform they own, Peacock they own, and sometimes you just have to go to one person, and they'll tell you where they're going to place those dollars, okay? So, Telemundo, Univision Radio, they have Univision Digital, they have TUDN, which is their sports, very niche markets. So you have to really kind of take a step back. You know who you're going to want to reach. This campaign, we knew was going to be a Spanish language campaign from the very beginning. Before I forget, I want to shout out to our team involved that joined us back then. We saw them born from the very, very beginning, the palette and everything. So it's only the campaign involved. But in your markets, you know a little bit about where you want to place people in one entity, and they're going to tell you it's going to live on Facebook or Chico, or we're going to put it on Instagram or another personality, or just fewer messages to be 95 seconds long for it to resonate. Okay, what's the message that you want to also get across? Is it just informational? What's your call to action? You want people to call a number. So basically, it's just look at your market and who are the players, and that one representative or person will get into the right one, not get to the $5 billion. And you'll become very popular that way. Once they know you have a little bit of a budget, you'll become everybody's going to want a piece of you. So, but do look at what's available. Billboards is another one. You have to also remember there was out of home, there's a lot of stuff in like laundromats, there's metros, there's buses. Take a step back and kind of take a look at what's out there and what's going to resonate best with the audiences that you want to reach. Just a little helpful. Anybody else want to add?
And I'll just say that one of the things that I learned from Cristina was have conversations once you place the ad. right? It's okay to give them a call and be like, how, you know, how's it doing? How, like, you have suggestions for me? Was the message working? And I think that this is where, you know, our friends at Leap played such a critical role that they actually aligned every placement of an ad to a hotline number. That where we were able to tell you specifically how many calls were generated from that placement and get a cost per appointment on every single placement, which seems like wow, how do you do it? But it was really just literally, it's running these states. How's the call center doing on that number? Oh, we got 10 calls. Okay, let's take the investment divided by those calls as the cost per appointment, right? And I know I did the deep dive analysis for Meta and our executive leadership, and I was like, really just dividing up the numbers, right? So that's something that was very new for me, that I think was just so important, that there is a ability and agility to adjust if it's not working, right? And it's just have a conversation, right? Now I want to go back to Carlos on the work that you all did. You know, I think the biggest, and I'll say it's kind of what we haven't talked about yet, but it's such a big issue, right? Which is disinformation, right? Online. That we had to deal with the social media bias, not the social media bias, sorry, the social media posts, even, you know, the more, once you do the ads, it gets out to a broad audience. So then you start looking at the comments, right? And you're like, holy smokes, wait a minute. And so for folks who are you know, trying to do social media ad buys and are really looking at, you know, another take at this, and I know we had various conversations on like, when do you delete a comment versus respond to a comment? I think there was always this assumption of like, everything is disinformation. And then we have to step back. And I know I have conversations with Rosa about this, right? About like, some of it is not, it's actual concerns. Like it's actual concerns of, am I gonna get COVID if I get the vaccine? So a lot of people would write that off as like, oh, they don't know, right? No, just answer the question, right? And so from your perspective, Carlos, in doing this on the, you know, on the ad buy end, experiencing kind of the organic side, what were some things you learned in the campaign? And I know that this campaign was very unique to the usual campaigns you all usually take on. What are some lessons learned on combating disinformation and just, you know, kind of lessons learned in general from engaging with us in this work on the social media front?
Well, I think that one of the important things that we did right up front was that we created a really long list of frequently asked questions or potential questions that could come up in the campaign. And we all went through it extensively. I mean, this thing was like 40, 50 questions long, and we went through several rounds to make sure it was correct. And then we kept updating it, you know, as we evolved. But yes, we need to stay on top of those comments and questions that come in. And I would say the comments are like kind of, you know, something you need to check throughout the day, several times a day. And we have like several people checking the comments on paid ads and also the organic ads, because some people do use it as a way to spread misinformation. So they would go on there and say, hey, check out this video about why you shouldn't get the vaccine because it's going to do X, Y, or Z to your body, right? They put a link in the comment. So stuff like that we would remove. We don't want to spread disinformation. Genuine questions that we could answer, we would answer them and answer them quickly. And even if it was something that was like, you know, kind of a myth, we would say if the person was genuinely asking a question and they wanted to know, they weren't sure, then we would post the answer. You know, sometimes you might get someone that they just want to argue and they get profane, then we would delete those as well. So you kind of have to take it on a case-by-case basis, but definitely it can't be something that you let fester and just sit there, because it could end up being bad. You know, it can reach, if you're paying for an ad to reach thousands of people, and then in the comments there's this information and you're literally paying to spread this information, because you have your ad and then you have all the comments at the bottom. So it's really important to keep an eye on that. So that's one thing we definitely want to just be vigilant and be checking it all the time, every day, all day, pretty much.
Yeah, and I, you know, something that folks have like mentioned in different ways, right, is the engagement piece, right? That there really is a difference between broadcast and engagement, right? When it comes to doing kind of communications work. It's interesting because in my previous life and actually running a communications department, one of the big things that I had to do is actually assign a person to answer comments, right? To answer the Facebook Messenger, and that's where it really mirrors the community work. Everyone will tell you, like, I ran for office myself, and the what helped me the most was I just went to the door and I answered the voters' questions, and I had a conversation with them, and I don't know how many steps I did during that time, but it's that direct engagement. And so how do we use these communication platforms to have that same engagement, right? To talk to someone when they send you that message on Facebook, right? That you may be the person that leads them to get on the path towards vaccination because they just had that one little question that you were able to answer. And so this is the other reason why I always bring up like the path towards vaccination, because it doesn't mean that, they saw a video of Dr. Shapiro and then and then I did an interview or something and someone said, yes, now because they said, I'm going to get vaccinated. It might have taken 4 videos, it might have taken radio interviews, it might have taken a social media post, and then them finally saying, okay, you know what, I was walking by La Clínica and they also had an Ándale, Qué Esperas, so I'm just gonna do it at this point, right? And so it's important to think about platforms in that way, that it's conversation and engagement versus just kind of telling people what to do, right? And so, wanted to share that because I heard kind of all that come up in what you all shared. And at this point, I wanted to just kind of do a rapid fire, right, again, on what are the lessons learned from this campaign? What are the kind of golden nuggets that you want to leave folks with here that they can use for their work, right? And I think the other thing, again, there's no secret formula, right? So it really is these golden nuggets and trying them out. And so let's start off with Dr. Shapiro and work this way.
Do everything in Spanish, English, and Spanish. We tried it a couple of times and we got amazing things in one one. And you never know which one will be running. And the algorithms of these things actually change all the time. But the thing that actually will not change is that if you disseminate information quickly between your groups, from La Clínica, from Saltillo, if your own group starts like spreading the same message, and suddenly it pops in the radar, and we disseminate it, Excel, and we start bringing people, that actually helps. That make sure that you have your fire starters. Don't think that the community will be waiting for you, like, oh, it's right there, but you should just send a text message. And Instagram, oh, now it's time actually to go and check it. They say, oh no, you'll be probably on the restroom, sitting down and taking this off and next minute. But I'll be there with them. That's the thing. That's the thing. We need to be there with them whenever they want. That's one. The other one is make sure that you're involved in your home. By involved, meaning that all media stuff it's back and forth, and sometimes it doesn't work. You get a lot of trolls, and we're talking about trolls. And sometimes people like, well, why are they saying that? Who has kids here? Were you afraid when you were here? In all honesty, it's a really good question. It will give you the sentiment that whenever you're posting something, you need to have this. Who was afraid when they were giving the kids, your kids, when you were making the decision to vaccinate your kids? It's okay. It's okay. It's perfectly okay. And who was not afraid when you were getting your vaccine? Like most of us, we had a feeling of what's happening. Like, I know this is a great thing, but we need to connect with our community. Remember here, we're really good. I always tell my patients, I actually, whenever I can, I sit down, like, actually, if I need to have a grant and actually talk to the patient first, that's how to work. Because I don't want them to see me here. I want to be, we're not one of them, you're part of their team, you're part of that team. You're not the coach, and you're not the coach, you're part of the team. Whatever needed, Cristina, Carlos, and we said how they coded frontline defense and everything else, and that's what we need to do. Whatever they need us, we need to be there. Be humble, be honest, be there, be constant. Because if you're not constant, everybody's saying, I'm not leader, everybody's saying, I'm not 4 followers. The next week, you're like, not awake, and just be constant. You shouldn't have a factor. That's the
From my perspective, and news specifically, remember that you are the news. You are the one who are feeding those news outlets all of this information. Don't be afraid. Remember that even if it's a Spanish language outlet, call them and talk in English if you're uncomfortable or don't know the words. Just don't be afraid. Know the long format, know a short format. Get yourself trained on your talking points. If you're going to just use 10 seconds, make sure you succeed and you're getting your message across. Never look at it as question and answer. It's question and message. Question and message. Never an answer. It's what do you want to get across. You are nuggets to all those people who want content. Don't be afraid. Before I go, I do want to plug PBS Earth Focus. It's a show that continues to air. You can watch it on PBS. It's called We Are Where We Live, and it deals with social determinants of health. It was featured in our Southgate clinic, and they interviewed several of our physicians and our patients. Dr. Shapiro was featured. Very, very telling for anybody who doesn't understand that our health is determined on the zip codes that we live. Please, I encourage you, I'll make sure you set and push it out to everybody, but it's super helpful on people who don't understand that access equity is based on our zip codes. So don't be afraid. Please feel free to reach out to any one of us to help as well. Again, all of you are the story. If you'll ever forget, you'll be great.
For me, I have 3 things kind of based on what we talked about today. So first is really understand the difference between your Facebook feed, where you put up longer messages, maybe longer videos, articles, and that type of thing, versus the advertising side, which needs to be really short and to the point and have a clearly defined call to action, because that's the only way you're going to be able to measure what you're spending in terms of dollars. That's the first thing. The second thing would be to realize that people have really short attention spans, and you need to get the message across and kind of respect their time, because they're only going to see your ad for a few seconds, if that. They may skip it. Don't be afraid to try different messages, as I was saying, don't be afraid to fail. Try some messages that may not work, or maybe you don't think they're a good idea, but then you run them and they're a great idea and they perform really, really well. And then the last thing is to try to be a resource and a guide and just kind of be there for the community. I mean, I think that'll get you farther than anything else. I mean, just being available for people that have questions or that have doubts or concerns or they're not sure. If you're just there to answer questions and you're there as a resource, I think they'll appreciate that really, really well. And it'll just do wonders for, you'll be an amazing resource in their eyes for the long term.
Yes. Yes.
same question.
Oh. I think I said a lot of, I think what I would recommend for folks, one is not being afraid to be a storyteller and being a brand for yourself and representing yourself, right? Two, trying things out. I think a lot of time with service provision, with these deliverables that we have, right? With like getting into work, the like, I think I have like 8,000 unread emails right now, and like you get in these, and we forget how important creativity is to this work. And I think allowing yourself that creativity to do that, I think is important, because we don't always allow ourselves to do that. I think seeing ourselves again as communicators, like I could never get the response that my mom gets on a WhatsApp group message. Never, right? Where she'll be like, and she'll grab my videos and she'll be like, ay, estoy tan orgullosa de mi hija, aquí está su video para que todos lo vean. And my mom used to be a preschool teacher, and they're like, gracias, Miss Rosa, and her network is right at that, right? Like they're like, we will share it because it's Miss Rosa, right? And so I don't have a network like that, right? And so really hone in on like, you have more power than you think, which I think hopefully you gathered from all of these panels, that you're a storyteller, you're a communicator, you know your community. And building those relationships, right? Everything we've talked about consistently relationships, right? Across all of these, and maintaining those relationships takes being constant. It takes understanding what you're working on, those folks, what you bring to the table with these folks, and sometimes just checking in, right? I think every reporter that I work with at Univision that I follow on like Instagram or whatever, if they have like a wedding or whatever, felicidades amigas, muchas gracias. And that's the culture that we have, right? And that's the difference. So the biggest one is just go for it. You might fail, but what if you succeed, right? So those are my kind of rapid fire. With that, I wanna thank the panel. You guys, you all, right? And so it's just been such a pleasure to also have folks that think outside of the box, even in place times where it's like La Liga Mexicana. I was like, oh, we can do that? Because I was like, yes, and then all the kids will have the shirts, and I'm like, we can do that. Yes, and then we have Chespirito. I'm like, wait, we can do that, And so, really part of the creative work for this and with my colleagues here was just dreaming big, and so seeing it on the screen and seeing it all come together, and with the work that you all were doing on the ground, which is what the connective tissue to what we did, was just great. So thank you to the panel again. Mil gracias. It's been a pleasure to work with you all. Now we have a very exciting 20-minute break, which I'm sure I can definitely use. And so after the break, we're going to do our presentation from you all. We've been giving you all this information, talking to you, and we're going to hear from you all. So we'll come back and do that, but network, grab some water, there's more buttons, but thank you.
I sent something to
¿Se escucha?
Yes.
¿No? A ver, ¿mejor? ¿Se escucha? ¿A los de atrás se escucha? No están platicando. A ver, ¿qué va a hacer? If you can hear me, clap once. If you can hear me, clap twice. If you can hear me, clap 3 times. Give yourselves a round of applause. You guys are amazing. Ok, para esta porción del programa, como dijo Lisette, vamos a entregar el micrófono a ustedes, a todos los promotores, promotoras, PhWs que llegaron aquí, a todos los que vinieron de las clínicas, los que viajaron de largas distancias a estar aquí con nosotros, les vamos a entregar el micrófono. Y vamos a comenzar con nuestros amigos y amigas de la clínica. A ver, ¿a quién le entrego el micrófono? Ah, ok.
Nosotros estamos representando la clínica de la raza y hoy vamos a hablar un poco sobre los temas. Okay. We're gonna be talking about what the promotor has helped us with and everything we're able to accomplish. But first, I'm going to introduce myself. My name is Alexandra Briseño, and I'm with the Coco County Clínica. Buenas tardes a todos. Good afternoon, everyone. My name is Aidin Gonzalez, and I am part of La Clínica de la Raza's health education program for the community, and I am part of Contra Costa and Solano County.
Hola, hola, buenas tardes. Mi nombre es Claudia. My name is Claudia Briones. I'm actually from Alameda County. We're representing Alameda County Community Health Education, Casa Che. And we're here, and we're really excited and happy to be here.
Buenas tardes a todos. Es un placer estar aquí con todos. Yo me llamo Amanda Renteria. Hello everyone, good afternoon. My name is Amanda Renteria and I am from La Clínica de la Raza in Alameda. I work alongside my manager, Claudia Briones, and it's a joy to be here with you all.
Okay, so I'm gonna start presenting in English, but my partner here, Aileen, is gonna be the one to translate in Spanish for the Spanish speakers. So we're gonna start off by talking about our vaccination events and how we move forward with doing that and being able to produce it. So at our vaccine events, just to give you guys an image, what we do is with the help of Alameda County and with the Coco County, we have ambassadors that help us actually register the people who came from the community to get the appointments for vaccination. After that, the promotoras do basically the whole job. So they help us, once the patients receive their vaccination, we have a process called observation, and it's during the 15-minute wait after a person is vaccinated. During this process, the promotoras then speak to the patient and give them a survey, which is what we bring back to Ándale, and they're the ones who basically do everything. So during this time of the observation, what we do is we have a table with our booth information, and we actually give a lot of products to the patients just to help them out, give them more information about community resources. So during this time, it's hard to talk. So during this time, what we do is we give them vaccine cards, we give them information on community events, what's going on in our community clinics around our area, in our county, and we also give them information about other clinics in their area that they may register or become patients of. And we also, once we started having children come in with us, we were giving them gel pads so that they could administer in the section where they got the vaccine. And we were also giving them stickers and balloons. During this time, we were administering vaccines for up to 300 or 400 people during these events. So just to highlight where we were doing these vaccination events, we were doing them at flea markets, schools, churches, clinical sites, community centers, and supermarket parking lots. Buenas tardes a todos. Yo también como Alexandra me voy a quitar la máscara porque
It's a little difficult to speak with it. Es un poco difícil para hablar con la máscara. Pero, como estaba diciendo Alexandra, nosotros no pudimos hacer esto sin la ayuda de los promotores, la verdad. Entre los 3 condados tuvimos como unos 20 promotores que estaban ahí siempre con nosotros ayudándonos a hacer alcance, estando en estos eventos. Tuvimos eventos en las pulgas, en las escuelas, en los parqueaderos de las tiendas de comida, también en las iglesias, en algunas de nuestras clínicas que tenemos en Oakley, en Oakland, en Vallejo, en Monument, que es en Concord. Y también las tuvimos en los centros comunitarios. Cuando venían las personas a vacunarse, durante los 15 minutos que estaban esperando, nosotros le hacíamos las encuestas que después les mandábamos a Ándale para que tuvieran la información de cuántas personas vinieron. También les estábamos regalando unas cositas, teníamos una mesa similar a esta, con la información, teníamos flyers de dónde pueden irse a vacunar, si necesitaban agarrar también exámenes de COVID, de nuestros próximos eventos, si no podían acudir un familiar a ese día. Teníamos también desinfectantes de las manos, máscaras como esta. También para los niños, cuando los empezamos a vacunar, les empezamos a dar unos geles así congelados para que se los pusieran donde les dieron la vacuna. Teníamos stickers, teníamos globos, stress balls, las pelotitas esas para hacer ejercicios de la mano, los bubbles también, y también les dábamos una tarjeta para proteger la tarjeta de la vacuna, porque en ese entonces no se hacía la digital todavía. Okay, so we're also going to move forward to start talking about the data highlights. So just to give you guys a vision of the numbers that we actually produced during this time, we have 517,014 people that were reached through our outreach agency. And this was since the start of spring of 2021. We also had about approximately the volunteer hours of our promotoras was 3,650. It was about 37 promotoras that participated from our 3 counties, which was the Solano, the Coco, and Alameda. We had 18,339 supporting services. So this did include social media, it included the appointments, it included phone calls, insurance enrollment, anything that we really used to support our community members and the resources that they can use that were available and free to them. We also had 389,941 approximately people reached through our the Ándale, Qué Esperas campaign through our efforts, and 16,424 vaccines administered through the campaign, and 109 and 133 vaccines administered through La Clínica alone, starting since spring of 2021. Ahora para las estadísticas, déjenme acá porque no puedo leer de allá, pero tuvimos 517,014 total personas que pudimos alcanzar con nuestros eventos de outreach, que es de alcance, de ir a dar los flyers, a dar información a la comunidad, a los eventos comunitarios. Entre los promotores fueron 3,650 horas que ellos voluntariamente dieron entre todos ellos para poder ayudar a su comunidad. Fueron 37 promotores entre los 3 condados, que fue Solano, Alameda y Contra Costa. También fueron 534 eventos que tuvimos en la comunidad, ya sea en las escuelas, en las pulgas, como dijimos anteriormente. También fueron 18,339 servicios recibidos a las personas, ya sean registraciones, sean que les hicimos las citas, que pudieron que hicieron llamadas, también que pudimos ayudarles a inscribirse, a tener un seguro médico también. Fueron 389,941 personas aproximadamente que pudimos alcanzar con la campaña de Ándale, ¿Qué Esperas? Y también fueron 16,424 vacunas que pudimos administrar también con esta campaña de Ándale, ¿Qué Esperas? Y también fueron 109,133 vacunas administradas solamente con la Clínica de la Raza en sus sitios clínicos.
So también, como muchas de nuestras promotoras no pudieron estar aquí con nosotros, sí tomamos unas reflexiones. I forgot I was supposed to speak in English, I'm so sorry. But sorry to recap. So fortunately, our promotoras, most of them weren't able to be here today. But what we did is we did a little event for them and we were able to get some of their reflections. So just for the sake of having some space, we only put a couple here. But just to reflect, I'm going to give you 2 quotes of what the promotoras had to say. One of them said, I met people who were up for a challenge, regardless of the conditions to serve, and extended their hand to help other people. And that was from Yesenia. And then another one was, I was able to help a father of a family get vaccinated because he was afraid of the vaccine. But because of the way I spoke to him and reassured him, I was able to convince him to get the vaccine on site. So we have Isabel, who most of you saw speak earlier as well, and she's another promotora. And Annie's going to be able to translate those in Spanish for our Spanish speakers.
Bueno, también pudimos darle a nuestros promotores un evento de agradecimiento por todo el esfuerzo y su dedicación y todo el trabajo que han hecho. De verdad que muchas gracias a ellos, porque sin ellos no pudimos alcanzar estos números. Y algunos de sus reflexiones de ellos, les preguntamos qué se llevan de esta campaña. Todavía no se acaba el trabajo, sabemos, pero ¿qué se les pegó a ellos de todo esto? Y una de nuestras promotoras, Yesenia, dijo que conocer personas dispuestas a retar las condiciones para servir y tender la mano a otras personas. También otra de nuestras promotoras, Aide, dijo que haber podido ayudar a un padre de familia a vacunarse porque no creía en la vacuna y mi forma de hablar con él lo convenció a vacunarse ese mismo día. Y también tuvimos la reflexión de Isabel, que dijo anteriormente que con un niño chiquito que corrió a sus brazos, le dio un abrazo y le dijo, ¿sabes qué? Gracias, amiga, por estar aquí, por ayudarme a no tener miedo a vacunarme. Muchos promotores estuvieron ahí, pero estas son algunas de sus reflexiones de ellos.
Y también, additional also from not just only having the promotora reflection, we were also getting a lot of community members' reflections in. One of the ones that stuck with us the most was about a patient. Her name was Consuelo. And her story stuck with us a lot because it just really reflects how empowering it is what we're doing. So her story was that during COVID of 2021, unfortunately, she had lost her daughter and another family member. And to just get her mind off of things, a couple days, weeks later, she actually went to the flea market. And she saw one of La Clínica's informational booths there. And she said, you know what, I'm just gonna go, I'm gonna talk to them, and I wanna see what they have to say to reassure me or what it may be. So she did walk up and she talked to one of our promotoras, who our promotoras received her warmly and told her everything she needed to know, all the information that was available. Heart, I will be vaccinating myself today. So that day, she actually took the step to vaccinate herself, and she went out of her way to come back and thank Maria Reyes and La Clínica and say thank you so much for being there that day, because if you weren't, I probably wouldn't have been vaccinated. So that's just a little of just one person from the community who came back and had something to say.
Tuvimos un testimonio de una de las personas que ayudamos, se llama Consuelo, y ella en el 2021 perdió a unos de sus familiares debido a COVID, una de ellas siendo su hija. Y algunos días, semanas después de que su hija falleció, ella decidió, ¿sabes qué? Me voy a salir de la casa, me quiero distraer, no quiero estar pensando en lo que está pasando, y se fue a la pulga. Afortunadamente, la clínica tenía una mesa de información similar a esta. Y ella dijo, ¿sabes qué? Por el miedo que tengo, no quiero hablar con nadie de esta situación. Pero como que surgió algo en ella, dijo, voy a ir a hablar con ellos a ver qué tienen que decir. Y una de nuestras promotoras platicó con ella, le dio la información que la clínica tenía. Y dijo, ¿sabes qué? Tus miedos, esto es lo que está pasando. A lo mejor no tienes la información que necesitas. Entonces, esta es la información que debes que tener. Y a través de eso, ella decidió ese mismo día de que se iba a vacunar y que ya no iba a tener miedo. Y ese mismo día hizo la cita y se fue a vacunar. Después de eso, ella regresó, habló con nuestra manager, María Reyes, que está aquí también,
y le dijo, ¿sabes qué? Quiero agradecerte a ti, a la Clínica de la Raza y a tus promotores porque ustedes me dieron esa fuerza y ese como alivio para poder yo ir a vacunarme.
And as well as with our community member support and our promotora support, none of this would also be able to happen without our partnerships. So some of our partnerships that we carry throughout Alameda, throughout Solano, throughout Contra Costa was Hijas del Campo. And Hijas del Campo, they're another organization that excel and go out of their way to help campesinos. As you guys know, or may not know, but in Contra Costa, towards like Antioch, Oakley, Nixon, all that area, it's a lot of fields. So a lot of our campesinos are working there. And you know, one of our main questions in the East Counties was who's going to get to them and how are we going to get to them? So with the help of Hijas del Campo, we were able to go out of our way and with our mobile team, go to the fields and vaccinate our workers and vaccinate these people. Also with the help of Monument Impact, and we also have Monument Crisis Center, the Family Justice Center, Contra Costa Health Services, Solano Public Health, and Alameda County. And that's just to name a couple, but without their helps and efforts, we wouldn't have been able to reach as many people as we did. We were able to do outreach work, social media work, and they were also able to refer their patients or their community members to us to be able to just get vaccinated as soon as possible.
Bueno, nosotros no pudimos hacer eso con los promotores, pero tampoco con, sin nuestros personas que nos ayudaron también, organizaciones que estuvieron dispuestas a ayudarnos, que fueron Hijas del Campo también. Sabemos que los campesinos de verdad no pueden salir mucho, no tienen mucha de la información o no tienen muchos servicios que llegan a ellos al campo. Entonces, con la ayuda de las Hijas del Campo y también nuestro equipo móvil, pudimos ir también con ellos al campo a vacunarlos durante las horas de trabajo. Monument Impact también estuvo, Village Community Resources, Monument Crisis Center, Family Justice Center, también Contra Costa Health Services, Alameda County. Entonces los condados también nos estaban ayudando mucho para patrocinar esto y para que las personas hagan.
So, también tenemos aquí los de Alameda que nos van a asistir con lo próximo que tenemos para representar. So Alameda County is going to help us present the rest of the board for you guys with more information.
A ver si están poniendo atención. ¿De qué condado soy yo? ¿De Alameda, Solano, Contra Costa? Okay. Ok, entonces ahorita también mi compañera aquí, Amanda, me va a ayudar a traducir en inglés, pero voy a empezar a hablar sobre los proyectos que hemos alcanzado en los 3 condados. Uno de los proyectos que es bastante importante ha sido el de los posters que pusimos en el buses de todo Oakland. Queríamos que estos posters fueran diseñados con la idea, no necesariamente de la vacuna, pero dar una oportunidad a las personas en sentir el sentimiento de esperanza. Ese era el propósito. Entonces hablamos con una agencia donde ponen todos los anuncios de los buses de Oakland y ellos nos ayudaron a crear el tipo de campaña, pero también hablamos con una artista local, se llama Sochi Guerrero, y ella fue que nos ayudó a diseñar estos posters. Y después hicimos una campaña sobre esos posters con la comunidad. ¿Quién había visto alguno de esos posters y qué pensaban de ellos? Si quieren más tarde pueden pasar y ver los diferentes posters que existían. Una de las cosas que vimos en la comunidad, que cuando nos mirábamos a las personas en diferentes lugares, el papá, el hombre, o el abuelo, o el tío, o el que está ahí, el hombre, en la comunidad latina, específicamente, forma una parte muy importante. Y si esta persona se vacuna, más seguros que todos en esa casa se vacunen. Lo hemos visto también en la comunidad MAM, que nosotros trabajamos muchísimo con esa comunidad. Entonces, lo que queríamos era alcanzar a esa comunidad, específicamente al hombre, al papá, al tío, al abuelo, y decirle, ¿sabes qué? Si tú te vacunas y si tú te cuidas, me estás cuidando a mí. Y ese era un sentimiento de esperanza, de responsabilidad para los padres, para los tíos, los abuelos del hombre latino. Era muy específico para esta comunidad. Y después un sentimiento de esperanza, un sentimiento de alegría al saber que estábamos tratando de salir de esto.
Hello, everyone. So as my manager, Claudia Briones, mentioned, some things that we wanted to tackle this time around was creativity. We spoke about that earlier, of the impact creativity can make an impression on our community, on ourselves. So what we did is we went locally. We found one of our local artists in Oakland, California, and through that collaboration, we worked with her, and we were there to kind of guide her in what we're hearing, boots on the ground. What would tap into the community? How would they resonate, not only with the images, but the color? Latinos, we love vibrant colors. So through the messaging, what we discovered is that hope, resiliency is a key element to thrive. So that's something that we incorporated in the artwork that we did with Sochi. Through that, we also recognize that in the cultura Latina is that the presence or the example a man can lead in the household is very pivotal. So we tapped into that, and we recognize that if we have images of a father handing down a mascarilla, a mask, the image of a father saying, "Vacúnate, get vaccinated," that will change the future of that household. So we tapped into those messaging. We tapped into the color and into the messaging of esperanza, of hope. And through those images, we decided to display them, not only through a campaign that we decided to launch, but in addition to bus shelters throughout Oakland. We specifically targeted zip codes that were probably more at risk, and through that, we got a great response. So through this experience, I encourage everyone, as it was noted earlier, to tap into the creativity, take a risk. You may succeed, you may fail, but at the end, it's the results that come from it of not only your community, but also the counties. So through this collaboration, we found great success, not only just regarding vaccines, but taking care of each other. I encourage everyone, if they have an opportunity, to come and look at these images, see what you would like to create in your own counties, in your own communities, but really tapping into, that emotional part. Well, art can speak so many languages. So tapping into that and focusing on the messaging, family, and not only family, but neighborhoods, community, helping each other out. And it was a wonderful collaboration to do with Sochi. And if you have any questions, we're here available for you all.
There were also other projects. One of them that you already know about. Otros dos proyectos, uno de ellos ustedes ya lo conocieron o ya oyeron de él, que fue el de la promotora y canciones, refiriéndose al COVID-19 y a su experiencia, pero también existe otro tipo de alcance que hicieron las promotoras, donde se les dio listas de pacientes de la clínica que aún no se habían vacunado, y ellas llamaban, fue una lista muy grande, muchas personas que no se habían vacunado, especialmente mujeres embarazadas, y que necesitaban tener la vacuna para poder ingresar al hospital y estar seguras. Muchas de ellas podrían haber ido y tomar un rapid test, pero lo que queríamos era que estuviera totalmente saludable y segura. Y también para el bebé estar saludable y seguro, y su pareja o la persona que la acompañaría. Entonces esa fue otra manera de que Contra Costa, Solano y Alameda, lograron que las promotoras y las educadoras de salud tuvieran ese contacto con muchísimas personas.
Another project that we tackled here at La Clínica de la Raza is reaching out to pregnant mothers. As we may all know that they're more at risk. So through that, we saw that there was a need to reach out and to be that source, that resource for them. So we did numerous calls. We collaborated with Contra Costa, Alameda. Through this collaboration, we reached many, many mothers. Through this collaboration, we also wanted to tap in and reach out to those partners who will be there with them during delivery. So also giving that information, a lot of individuals probably don't have access to know, oh, can I go to be there during delivery? What are the requirements? And this is such a pivotal moment in life, is to be there, to see your child born. And we wanted to be there to allow them to have the resources and the access to have that experience as they deserve. So through that, we're able to get partners, mothers vaccinated. We're also able to answer any questions that they had. It was, a mother going through this process could be a little stressful. So having the patience, having that time to educate them and let them know what their risks are and what resources they can tap into was something very fulfilling that the promotores, and community health educators were able to do for the community.
Y algunas lecciones aprendidas, no podemos hacer el trabajo solos. Necesitamos personas, necesitamos otras organizaciones, necesitamos promotoras, necesitamos gente que nos apoye a hacer el trabajo. Y no podemos aislarnos de la idea de solamente nosotros poder dar el alcance. El hecho es que todas las organizaciones que estuvieron trabajando con nosotros y las promotoras fueron muy importantes para hacer este trabajo un éxito. La otra lección que aprendimos es que tenemos que estar donde está la comunidad. No podemos estar afuera viendo cómo la gente adentro se está muriendo, está enfermando y nosotros simplemente decir, bueno, no es mi problema. Y lo bueno o lo malo es que casi todos nosotros estamos dentro de la comunidad. Vivimos lo que nuestra gente vive. Entonces, eso nos hace sentir mucho más responsabilidad porque sabemos que nosotros podemos hacer la diferencia de alguien esté vivo o no. Otra de las cosas es simplemente la presencia de tener la posibilidad de haber estado trabajando junto con un equipo móvil que pudo irse a diferentes lugares y poder dar la vacuna. Y también, como dijimos, las promotoras son un elemento importante para todo el alcance que se hizo. Y estar siempre, estar dispuestos a ir a cualquier lado que se les invite. Que sea fines de semana, en las noches, en las mañanas, frío, calor, no importa. Estar allí presente en la comunidad.
A few things that we learned through this experience is that collaboration is key. Collaborating with promotores, promotoras, community. Through that, we have found some great success. In addition to that, we also believe in the impact and the importance of meeting people where they're at. Through that knowledge, we were able to go to them and provide pop-ups, mobile vaccine pop-ups in the weekend. Through the responses of boots on the ground, having that one-on-one conversation, we learned that many individuals didn't have time throughout the week. So we decided, okay, well, let's create an event, vaccine pop-up in the pulga, in the flea market on a Sunday from 10 to 2. And through that, we saw great success. People would say, it's been a long time, I haven't been able to get vaccinated. And as we mentioned earlier, you can give them all the resources, but you need to understand what the need is. You need to understand, meet them where they're at. And having that knowledge and moving forward with that, we found great success. And it's been such a joy to be there along the way to support them. All the communities that we've interacted with remind me of my family, mi tío, mi tía, mi abuelita. And I even get emotional because we do our best best to be there for them. We do our best to hear them out and advocate for them. And through collaboration, meeting them where they're at, we have found great success. And thank you so much. And I'll lead it on to Alan.
Thank you. Yeah, I know it's a lot. It's a lot of information and it's a lot that's going on. But honestly, quite frankly, this is just a portion of it. During these months, it's been a lot that we've done. And, you know, just to give an example, during the event that we gave the promotoras and the reflections, they were able to actually sign this banner. And we're gonna have it out and open in case you guys wanna look at the reflections and read and really grasp the perspective. Like they were mentioning, to be part of the community, you have to be in the community. So this is a perspective that we brought along with us since many of them weren't able to be here with us. So nomás quiero compartir que se siente como que es mucho, pero la verdad que esta es una parte bien pequeña de todo el gran suceso que tuvimos estos meses. El evento que les mencionamos anteriormente, tenían los promotores expresar que es algo que quedó con ellos y que reflexionaron de todo lo que hemos hecho en estos meses. So esta bandera la vamos a poner para que los que quieran poder leerla. So we're gonna end and close here with playing Isabel's song. I know that we had mentioned it, but we haven't played it. So we're gonna go ahead and play that for you guys. You guys can just get a perspective of one of the promotoras was here and what her battle was and what she went through with COVID. And just go ahead and enjoy it.
En el cielo, su mensaje es más claro. Para que puedas vivir. Una vacuna no es nada, por estar con los que aman.
¿Se escucha? Ah, perfecto. Muchas gracias a la clínica. Gracias a todos. Ahora quiero invitar a todo el equipo de la clínica que suba acá arriba rapidito. Tenemos una presentación que vamos a hacer. So I'd like to invite any two members from the clínica to come up for a second. We have a quick presentation that we'll do with every team. El congresista, el doctor Raúl Ruiz, mandó reconocimientos para todos. Entonces, les queremos presentar un reconocimiento de parte del Congreso de los Estados Unidos para cada equipo. Entonces, voy a leerlo en español y luego en inglés. And then I'm going to give a heads up that San Isidro, you're next. If you guys want to tee yourself up over here. Team San Isidro, you'll be up next. Voy a leer el reconocimiento. I'm going to read out the certificate. So in English and then Spanish. A certificate of congressional recognition is presented to La Clínica in recognition of your heroic leadership through the Ándale, Qué Esperas COVID-19 vaccination and education campaign to bring life-saving COVID-19 vaccines to Latino communities throughout California and to their most vulnerable individuals. Your stewardship of valuable and limited resources, countless hours of work, and tireless dedication to public health have made our communities and families healthier and have made California stronger. Ahora en español. Este certificado está presentado a la clínica por su liderazgo heroico por medio de la campaña Ándale, Qué Esperas y por traer vacunas a las comunidades latinas por todo California, especialmente a los individuos más vulnerables. El uso de recursos limitados creativamente por ustedes y las horas sin contar de trabajo y dedicación a la salud pública han hecho a nuestras comunidades y nuestras familias más saludables y han hecho al estado de California más fuerte. Entonces, con esto les presentamos este certificado a ustedes y luego vamos a tomar una foto de grupo. We're going to do a group photo. All right, San Isidro, you're up.
Everybody, look right here.
Okay, next up we have the team from San Isidro, and I'm going to turn on the microphone.
Yes.
How we doing? You guys hear me? Testing, testing. Hola a todos, buenas tardes. Mi nombre es Ramiro Favela. Soy el Program Manager de la Unidad Móvil Médica de San Isidro y es mi compañera Inés Giraldo. Ella es una coordinadora de promotoras para la clínica de San Isidro, el departamento de la Unidad Móvil. Antes de darles todos los datos, todo lo que hemos hecho, de hecho, algo que Inés hemos pasado durante los últimos casi un año, ha sido un cambio gigantesco para nuestro departamento. Nuestro departamento, un poquito de backstory, ¿no? Nuestro departamento estaba creado para ver solamente niños, el área pediátrico, ¿no? Llegó COVID, llegó la pandemia y desafortunadamente tuvimos que suspender todos los servicios que nosotros proveíamos en la comunidad. Tenemos un RV, una unidad móvil médica, donde ofrecemos servicios a la comunidad. Affordable housing complexes, departamentos, supermercados, en parques, en centros de recursos, etc. Llega COVID, nos arrebata la oportunidad de ofrecer servicios para los niños, ¿no? Todos esos años tuvimos diferentes proyectos, desde el departamento se deshizo temporalmente. Luego llega uno de mis gerentes y me dice, oye, está la iniciativa de poder brindar vacunas en la comunidad y yo sé que tienes la unidad móvil, ¿qué te parece que podemos trabajar juntos? Yo dije inmediatamente, es una oportunidad de reactivar las unidades móviles, es una oportunidad de trabajar con la comunidad y agregarle valor a donde va la unidad móvil y donde va a salir si lo que hacer. Y dije, ¿sabes qué? Vamos. No había cómo, no había un guideline, no había un workflow, no había absolutamente nada más que las ganas de querer ayudar a la comunidad. Solamente había las ganas, había el compromiso, había la misión, había la misión que queremos llegar, ¿no? Entonces, mi trabajo fue regresar a todo mi equipo del departamento y decirles, miren, chicos y chicas, esa es la situación. Lo que queremos hacer es tener nuestra comunidad, aplicar la vacuna al hombro de cada persona, y es información, es compromisos, son conversaciones. Sabemos que no es tan fácil. Vamos a tener que ganarnos cada vacuna que nosotros podamos poner en sombra de esta persona, ¿no? Y fue lo que hicimos. Juntamos a todo el equipo nuevamente, empezamos a buscar colaboradores, empezamos a buscar una manera de poder ser eficiente, ¿no? De llegar a las personas con las promotoras, de verlos donde están comprando, donde viven, donde van a dejar sus hijos a la escuela, donde van a su comunidad para tener su cuidado de salud. Y es ahí donde nos tomamos. Les comentamos sobre los beneficios de la vacuna, les contamos sobre lo que es importante, no más de recibir la vacuna, no más para ellos, sino para proteger a toda su familia. Y es crear esas conversaciones, ¿no? Crear ese ámbito de confianza entre esa persona y nosotros. Es un trabajo monumental para nosotros de crear algo literalmente de la nada en tan poquito tiempo, ¿no? Por menos de un mes vamos a tener todo listo, unidades móviles, personal, workflow, materiales impresos, etc. Después de ahí fuimos afortunados de poder trabajar en áreas que estaban afectadas por el COVID. Y fue el área del sur de San Diego y el área norte de San Diego, ¿no? En todas esas áreas tuvimos muchas familias que no tienen acceso a vacunas, tienen muchas preguntas, hay muchas personas que a lo mejor no quieren ir necesariamente a un edificio a preguntar si pueden tener su vacuna, preocupados si van a preguntar si tienen notificación, cuál es su país de residencia, etc. Entonces había mucha más información que nosotros tuvimos que ayudar a aclarar, a despejar, ¿no? A lo largo de ese tiempo pudimos hacer 69 pop-up vaccination events, eventos de vacunación en diferentes lugares del condado, el norte y el sur. Pudimos tener alrededor de 30 y más promotores ayudándonos con diseminar información del sur de San Diego, el norte de San Diego y también. Tuvimos la fortuna de también colaborar con diferentes organizaciones, como ya comentamos, como escuelas, como high schools. Pudimos colaborar con resource centers, pudimos colaborar con la Cámara de Comercio de San Isidro. Y lo mejor de todo eso es que pudimos estar literalmente en la frontera entre México y Estados Unidos. Y ahí es donde mucha gente cruza todos los días para ir a trabajar, visitar a sus familias, de regreso. Gente que viene desde el interior de la República Mexicana a Los Ángeles, San Diego y todos alrededor. Entonces, tuvimos la oportunidad de que ver a esas personas a los ojos y decir, eso es por qué debería vacunarse, no nomás por usted, por su familia, por su esposa, por sus hijos, por quien usted más quiera. Hacerlo por las personas que tuvieron la oportunidad de vacunarse, ¿no? Entonces, para eso fue un mensaje muy importante. Mi compañera Inés y los demás compañeros tuvimos que ser responsables de aclarar ese mensaje, ¿no? Entonces, no nomás son los datos, es esa historia personal, ese compromiso que Inés, yo y el resto de todos el hicieron tuvimos con la comunidad, porque sabemos que hay mucha más información que a veces no es correcta, y era el propósito de nosotros de acabar con esa mala información. I think I'll go in English from here, and then we'll go back into more specific numbers. So for those English speakers, my name is Ramiro Tavera. I am the program manager for the medical mobile units for San Isidro Health. So a little bit of a backstory before I give you all the great details and information and data is that actually a month before we started working with Ándale, the program was pretty much stopped. There was no services, nothing we would offer. Previous to that pandemic, we would offer medical services for kids. We would offer physical vaccines. During that pandemic, unfortunately, everything was shut down, and the specific population had no access to care through the mobile unit. You know, the senior leadership came to me and told me, hey, there's this program that we could actually administer COVID vaccines for the community via the medical mobile unit in your team. Jumped in the chance to make sure that we could do this. Committed my team and myself and the rest of the organization to make sure that this is the perfect way to meet the people where they were, where they shop, where they eat, where they go to school, et cetera, right? So we reactivated the medical mobile unit with our team to make sure that we were, attending the call basically, right? So we were lucky enough to serve the northern part of San Diego and the southern part of San Diego. Again, with different schools, supermarkets, and resource centers. We were able to do this with about 69 pop-up vaccination campaigns hosted throughout the county with 30+ promotoras disseminating the information. One of the main thing with us was the geographic location where the mobile unit operates, and it really operates almost at the border. I mean, I don't think you get any close to the border from where we were. And we captured all of that population that, could potentially that lives in Tijuana, that works in the United States, all the migrant workers that come from inside, further down in Mexico and work in, the northern counties as well. So we were able to talk to those people, have conversations about it. And there's a lot of, misinformation out there where you hear traditional news, social media, etc. But it was up to, mi compañera Inés and our team to make sure we carry the message that, hey, there's actually more information besides this. I don't need to challenge your beliefs if that's what you believe in, but this is the information that I have that I can share with you. And hopefully after this conversation, if you trust us or not, we go ahead and give you a vaccine today. Most people were glad to take the vaccine, glad that they talked to Inés and the team to make sure that we were able to clear up any questions that they had. One of the big hurdles that we always saw when working with this community, when we asked them, why haven't you gotten the vaccine? It was very clear, it's always, nobody asked. And it's very powerful. So if we're asking people, we're approaching people, we're giving them the flyer, we're initiating that conversation, people trust us and they come and get vaccinated. So for us, it was really an emotional response to have never been asked. So I'm glad to see that after that, we're able to get promotoras and carry that same message across wherever we go, get people to get vaccinated, not just for themselves, but also their family as well. I'll go back into Spanish now. So no nomás era lo es la vacuna. La vacuna viene con un componente que es de educación que hemos comentado. Entonces, la educación, claro, viene uno a uno, como hemos comentado directamente en los eventos, pero también la educación viene cuando tenemos, igual, como clases de COVID, ¿no? Tenemos la información de qué es el COVID, cómo se transmite, cómo lo podemos entender, cómo lo podemos prevenir y qué beneficios tiene la vacuna, igual cómo nos protege la vacuna, a diferencia de las vacunas. Entonces, toda esa información es importante. Y la verdad, cuando nosotros confiamos en alguien, le decimos a todos, un restaurante bueno, un lugar bueno que ir a visitar o dar la vuelta, le vamos a decir al primo, la amiga, la tía, a todo el mundo. Entonces, exactamente lo que queremos crear, esa cultura de no te quedes con la información, comparte la información. Y si alguien te da duda, sabes que venga, pregúntanos, ¿no? No estamos aquí para competir con tu sistema de creencias, pero igual tenemos información y me gustaría compartirla contigo, con ustedes o con quien guste, ¿no? Entonces, es el trabajo que obviamente tenemos que hacer. Un arma que fue muy útil para nosotros fue también el uso de los redes sociales, ¿no? Tuvimos social media con era Facebook, Twitter, LinkedIn, Instagram, y todos tuvimos alrededor de 50,000 o más contactos entre esas redes sociales. Tuvimos alrededor de 2,000 o más respuestas, interacciones entre todas estas redes sociales, ¿no? Esas conversaciones donde ve uno el comercial, y ven y vacuna que estamos aquí en área de San Diego, oye, ¿cuándo? ¿A qué horas? ¿Qué cupo? ¿Qué necesito? ¿Qué puedo llevar? Todo, etcétera. Entonces, muchas conversaciones detrás de eso y es lo que uno quiere generar, ¿no? Tuvimos también alrededor de 28 entrevistas, ya sea radio, televisión, o social media también locales, y vamos a seguir diseñando esa información a lo largo de todo el condado, de esas comunidades. Definitivamente fue un proceso emocional para mí, yo creo que el resto de mi equipo, porque al principio de la pandemia, todo el mundo decía, ojalá hubiera algo para salvar la vida de mi familiar, mi hijo, etc. Y yo no entendía por qué la gente ya tenemos las vacunas, hay una manera de salvarlos, ¿por qué no tomarlos? Yo no sabía por qué hasta que hay que poder aclarar esas preguntas, esas dudas. Y qué bueno que tengamos esta opción de poder decidir A, B o C. Y toda la información que hay alrededor de nosotros para poder combatir este virus, ¿no? Y poder tener salud para nosotros y nuestras familias. I'll go back into this a little bit. So, throughout the pandemic, throughout the short term that we had to work with Ándale, we've had the opportunity to educate different people. So not just the one-on-one conversation we had with the fire or the patients, but also with our educational presentations where we had people that were actually looking to get more information, looking to understand how, why, what is COVID, how does it affect us, how does it transmit, how can it impact my life, how do I get a vaccine, where do I get it, what type of vaccines are there, how does the vaccine protect me against COVID. So all of that information again is being posted by these educational presentations. Again, it's incredible to see that people are actually looking for information as well. So again, it's always that ask, get vaccinated. How do you get vaccinated? Where do you get vaccinated? Everything was pretty much covered here. And again, a lot of feedback from that. Another thing that we use for our patient engagement was also social media. We use different social media platforms to reach different people, demographics, and locations, right? Such as Facebook, Instagram, LinkedIn, and Twitter as well. We had about 50,000 social media contacts. And out of those contacts, we had about 2,000 plus social media interactions, meaning that somebody had a question, an interaction, a comment, and again, we furthered that conversation, basically. A lot of people that have questions and again, interacted with us and wanted to share that information with somebody else. One of the things that we also wanted to share was to not just keep the information to yourself once you have it, but also disseminate it amongst your friends and family. Latinos, we always say that, once we like something, we know something, we recommend everything to anybody and everybody. Primo, un amigo, la tía, etc. Right? So that was the whole dissemination component to this, to make sure that we don't just keep the information, we share the information anyway. Other than that as well, we had 28 media interviews with some Isidro Health in the Qué Esperas campaign, whether radio, television as well, and different media outlets as well, like social media. So we were very successful in disseminating the information in South Bay community, in North County as well. And again, those are the communities that were hardest hit in those areas. Again, I'd like to still highlight the fact that we were able to reach those people at the border where even the older population stopped by and they wanted their grandkids. They were the ones sometimes disseminating that information. When the borders opened back up, it was a huge success for us as well because we were able to contact those people that wanted the vaccine but could not get the vaccine. So we had a lot of people come in for the first time and then bring their family members for the second time if they need to as well. So all of that was definitely an emotional response, an emotional trip for all of us because at the beginning of the pandemic, we really did not have a way to combat this. We were always asking for a way out of this, a thing that would, get rid of COVID. Now that we have these vaccines, to me, it's just magical that you were able to save a life, save a family member. And it's also, I believe, our duty to make sure that we disseminate this information because we lost people, we lost family and friends, and we don't want that to ever happen. So again, if you have the information, please share it. And I'm glad that I'm here sharing the stage with like-minded people because this is what we need to do. This is our commitment. This is what our talent is. So make sure we please disseminate the information. So, talked a lot now. I'm going to pass it over to my colleague Inés Giraldo. She is the outreach coordinator for San Isidro Health and the Movement Department. Take it away, Miss.
Mi nombre es Inés Giraldo y soy la una de las coordinadoras de enlace. Muchísimas gracias por tenerme el día de hoy aquí con ustedes. My name is Inés Giraldo and I'm outreach coordinator, and I'm going to say thank you to for having us here today. And today, since our program manager already shared a lot of information with you guys, ya que nuestro gerente del programa ha compartido mucha información con ustedes, quiero hacer brevemente un resumen. I just want to go ahead and just share with you guys kind of like a summary to make sure and see presence in our community. Solo para compartir con ustedes la presencia que hemos tenido en la comunidad en distintos aspectos. Okay, so basically we have been working, as you all know, South Bay County, part of San Diego County, and that's pretty much where we're stationed, right? Estamos básicamente estacionadas en la parte del sur del condado de San Diego, y ya que es una ciudad binacional, tenemos, pienso, el privilegio de poder servir tanto a nuestros vecinos que están en la frontera. Una vez que se abrió la frontera misma, pudimos ofrecer los servicios para todo aquel que quería tener beneficio de esto, ¿sí? So once, since you all know we're binational city, San Diego, right? We're right there across from the border. So once the border opened up, people were able to cross and get the benefits out of it, right? Which is to get free vaccine. Una de las preguntas que nos hacían era de que ¿cuánto cuesta la vacuna? ¿Qué requisitos necesito tener? No tengo papeles. So some of the questions that they brought it up was like, how much do I have to pay for it? Do I need any kind of paperwork? I mean, I'm not from here. Y eso fue lo que nos hizo ver a nosotros la necesidad de nuestra comunidad. Comenzamos a intensificar un poquito más este tipo de servicio. A veces llovía, a veces nos venían unos huracanes pequeños que se nos volaban nuestras carpas, pero seguíamos ahí. No matter what, the weather was, we have been there, present. And that's something that I really want to share with you. Algo de lo que también yo quiero compartir con ustedes que es muy importante es la presencia, y eso es lo que nos ha hecho tener éxito en el servicio a la comunidad. That's why we succeed in this community services, the presence of San Isidro, of our mobile health unit, been there twice a week or any time we call us to have a pop-up in our community. So we used to travel long distance sometimes, even went to up north, kind of like north of San Diego County. También viajamos un poquito como parte del norte del mismo condado de San Diego, a la ciudad Escondido, tenemos la clínica misma, y también en los eventos que hemos llevado a cabo, estábamos presentes, era constancia. Y todo esto se lleva a cabo por el mismo motivo de la pasión que tenemos, ¿no? So all this is possible based on the passion that we have, to continue serving our community, no matter what, you know. We're just looking forward, we're basic, and we've always been there to help and assist our community. And all this was possible due to the collaboration with all partners. And we are including here a lot of promotoras. Esto ha sido posible llevado a la participación de nuestros colaboradores, tanto como las promotoras que tienen un valor muchísimo alto que no se podría medir en realidad, y también con nuestros compañeros mismos del norte. Estamos hablando, cuando hemos llevado a cabo los eventos en Escondido, hemos ido también al Swappi, al mercado. Hemos estado en distintas locaciones apoyando a nuestros colaboradores, tanto como la Universidad Popular, hemos estado con Southway Community Services, con MAC, con la clínica de Neighborhood, y todo el apoyo, esto se ha logrado gracias a la misma pasión que todos tenemos para seguir sirviendo a nuestra comunidad. So all this has been possible due to the partnership that we have with different entities, especially in up north, you know, part of like the North County of San Diego. I'm talking about Southway Community Services, MAC, Universidad Popular, and Neighborhood Clinic, including others. And of course, always with our valuable promoters. So here, just to finish this up, I just want to share one of many testimonies that we have been seeing, basically at the San Isidro Chambers, which is, you know, our main location right before people be able to cross the border. Uno de los testimonios que les quiero compartir antes de ya terminar nuestra presentación es el que nosotros tenemos una locación ubicada en la Cámara de Comercio de San Isidro, que está justo un paso antes de poder cruzar a Tijuana. Y el beneficio de todo esto de estar ahí es cuando hemos escuchado, recuerdo un señor mismo que nos comentaba, qué bueno que están ustedes aquí, porque era un día de semana, un día de trabajo, era un horario muy difícil, el beneficio que tenemos, que brindamos, no necesitan hacer citas. Si ellos tienen algún problema, porque a veces no llevan nuestros clientes o nuestra comunidad misma necesita ese tipo de servicio, poderle completar la forma, estamos ahí, ¿no? Poniendo parte de que si hay alguna barrera de idioma. So one of this testimony is basically, I remember, and I was very impacted by this man. Actually, he was walking down San Isidro Boulevard, and we have our booth. Same, we pretty much set up our booth out there by the main sidewalk. And he kind of like, you know, walked by, and we approached him, shared one of our flyers, and told him, you know, we're providing the free vaccine. This is the whole information. And he was like, wow, this is really good, you know, because it was during the weekday, you know, work hours. And he was right before being able to cross to Tijuana. And all our services are for free. And especially that he didn't really need to schedule an appointment. So it was a benefit of it, you know. And as you guys have been doing all this hard work, we have been out there, and again, to continue, you know, doing what we love to do, which is serve our community. As long as we still providing services with passion, always being present, that's the way how we can continue building up that kind of trust with our community. Antes de despedirme, nomás les quiero mencionar de que pienso que los 3 puntos más importantes en realidad es el poder estar trabajando con el corazón, con esa pasión, sirviendo a nuestra comunidad. El segundo punto es presencia. Tener esta constancia, estar ahí, ¿no? Conforme a cuando hemos quedado que vamos a ir y seguir yendo, estando presentes para nuestra comunidad, para seguir ofreciendo los servicios. Y la tercera es de que de ese modo es como vamos a continuar construyendo ese tipo de confianza para que ellos sepan de que, oh, ellos están aquí para nosotros. Muchísimas gracias a todos ustedes, sobre todo también por la invitación, por el servicio que también siguen brindando a nuestra comunidad y a seguir trabajando todos juntos para que se sigan vacunando y se lleve a cabo todo esto. Gracias.
Y lo tomamos una foto con ustedes y próximamente tenemos a Golden Valley Health Center que nos va a acompañar virtualmente. Entonces, aquí les presentamos el certificado. Okay. Okay, so we have Golden Valley Health Center today. Presentation. Golden Valley.
Good afternoon, everyone. My name is Stacy Kuzak, and I'm the director here at Golden Valley Health Centers. And I was going to share a slideshow with you, but my screen doesn't seem to be working. So I'll just go ahead and talk through this. So it's been a wonderful opportunity to partner with the AQE grant and be a part of this endeavor. Our team has worked tremendously hard at reaching the community and all the different people out there during COVID and the vaccines and the community health workers. And I want to say that, they've worked very, very hard at the beginning of the opportunity. We were vaccinating, but we were hitting that point where so many people were apprehensive about the vaccine. And this really provided an opportunity for all of us to come together and vaccinate people and get out there, the Promodoras, the CHWs, to get out there and really talk to our community and help educate them. Throughout the grant, we vaccinated over 14,000 people, and we touched over 240,000 people with community health workers. So the partnership was great. We did lots of school events, pop-up clinics, church events, flea markets. We have mobile medicine teams going out and just vaccinating homeless population, rural communities, farm communities. So overall, it was a great experience, and we thank everybody for the opportunity, and hope to continue to learn and do different endeavors. But this has been a huge one with COVID, and I think the grant opportunity really helped us vaccinate and keep our people safe. So thank you.
Pillo, he's the one who creates the content for some of our posts, and Jasmine, who is our social media coordinator. I know that a lot of things have been shared today. We shared very common situations and familiar stories. Our community who live in poverty, they are, they all have similar conditions. So we know who we serve. One of the challenges for Latino Health Access is that we are not a clinic. We have been in the community for almost 30 years, providing educational services and support to improve people's health. That was a challenge, as Betty was mentioning earlier, all the battles that she needs to face to try to bring the vaccines to Latinos. You could imagine how it was for us when we did not have a vaccine. So we had the county closing places at the same time that cases were going up, and we were really struggling to have our community vaccinated. We know that Latinos were the hardest hit in the pandemic. Latino Health Access is in the heart of Orange County, one of the richest counties in the state. And then we are located in the poorest neighborhood of Orange County, Santa Ana. I want to share some of the numbers that we were able to reach in spite of not having the vaccine of our own. But we were able to provide through the Ándale, Qué Esperas campaign, more than 46,000 supported services. You know that some of those services included pre-registration for people who have technology barriers. We were also be able to translate taking care of pets, believe it or not. I mean, that was also a barrier. Also taking care of children. I should have mentioned them first, but I might not. In the one-on-one outreach, we were able to go over 450,000 people. Social media and media in general, over 25 million. And thank you to the group, because we had a celebrity here who is our vaccine. We also have Jasmine and the team who are constantly creating, taking pictures and creating content to address the most important issues that our community has. What else did we do? I just want to mention, oh yeah, that's gonna go again. Okay, thank you. So we really want to thank Altamed, because as it has been mentioned today, we were able to build more partnerships through this work. We were also able to make those partnerships that we already had a lot stronger. And we need to feel very, very proud of that. Our promotores are problem solvers, and they're constantly trying to find resources and a solution for our community. And we're very, very proud of them. We wanted to bring the whole banda here. Octavio said that the stage was very small, but we have 97 promotores working for this. Are people who live in the community, people who have the same struggles as the people that we were trying to serve. That's the key. Our CEO says that we hire the heart and we train the brain. I mean, we really want to have people who are really invested in the community and our trusted messenger. So I would definitely think that worked. We did also quite a few things that we think were very successful. We created this Facebook Live that first was called Pregúntale al Doctor, Ask the Doctor, and Dr. Shapiro was one of our first hosts there. And we were able to address the main concerns of our community in Spanish. We know that our community monolingual
not tech savvy. Those people really move into through Facebook. And that has been very successful. But the beauty of it is that when we wanted to have our youth promotores participating in that, the group said, we need to address the questions that the youth had for this. So we had younger people asking the questions to the doctor regarding their own concerns. When we talked about the COVID in the elderly and the vaccine in the elderly, we had the oldest promotoras and the oldest participants asking the doctors right there the questions. So we really think that we were able to educate through that platform, and it was so successful. The most beautiful one was when we interviewed a pediatrician, and we're actually children asking them questions. All of them are in our Facebook page. I invite you to really go through them. Then we realized that we were more successful if we were providing that information only in Spanish. So we continued doing so. And it was so successful that we now changed the name. And now the name of the segment, we have it every Thursday at 6:30 in the afternoon. And now it is called Platicando con Promotores, talking with promotores. We believe that promotores have the wisdom, the knowledge. We do not need to bring struggling, looking for people who can present. Our promotores have all the knowledge that can be shared. And we'll continue doing so, now not necessarily with COVID. We transitioned then to domestic violence. We all know how all the cases went up through the pandemic. And then we started moving through mental health, and now we're gonna go through other things, even elections. So just saying that, I wanna go back to one of the clinics was saying, be creative. One of the things that LHA has done throughout these 30 years is outreach. And one of the ways of conducting outreach that has been very successful for us is the creative outreach. That means bring something that is gonna attract the attention of your people, your community, like the vaccine here. She has gone viral on Instagram. So we also have the virus and several of the variants. These are papel mache, and these are this is artwork that our own promotoras made, and they would be walking in the streets. I don't know how Socorro can handle it, at 80 degrees, this is heavy. And she would be walking up and down, the streets of Santa Ana and dancing for half an hour, 1 hour. And this was a way of attracting people's attention, and then start the conversation. Start the conversation and then find out what the needs of our people are. And then, moving up, while going through those needs, as somebody was telling before, it was not the vaccine. People were being evicted. People had lost their jobs. People were hungry. We had at the beginning of the pandemic, whole buildings, with people who were sick. And then, these battles of bringing testing and the vaccines, the county shutting down testing sites at the same time that cases were going up. So it has been really a struggle. And we tend to make it fun and laugh, but this was very successful. We had a lot of people saying, oh, the vaccine sent me to get vaccinated. So we really thank you. We want to thank all the team of LHA, all of our promotoras who could not join. Our evaluation department people had to do, paperwork and be in HR and printing flyers and be in the street when it's hot and cold and raining. So we really want to thank all the work of the promotores, because we know that you guys are out there and you're rocking, and thank you so much for the job you do. Oh, they want me to go through the post. So this is Dr. Shapiro here at the end. This is one of the billboards that we create. It's one of the busiest intersections of Santa Ana. And it says, Santanero, ¿ya te vacunaste? Ándale, ¿qué esperas? So we got a lot of people, calling our call center saying, oh, I saw the billboard, and you will see, if you can, I don't know how good your site is, the virus here, children getting vaccinated, the promotoras being out there with the vaccine and the viruses, and just conducting outreach, people with the Ándale, Qué Esperas t-shirt, and of course, our partners. As somebody said before, we cannot do this on our own. Thank you, Ultimate, once again. And we want to thank all the partners who provided us with the vaccines, including the Orange County Healthcare Agency and who else? Santa Ana College, well, they did not give us vaccines, but they allowed us to be there in the place. The Coalition of Community Clinics, Pangea, the school districts, the Edgeworth Street Market, and all the people who opened the doors for us to have a site to get people vaccinated. So thank you so much for your attention, and we continue listening to you. Oh, okay. What's the wrap?
Pues lo que me emociona más es tener la energía para invitar a las personas a vacunarse. Cuando las invito me dicen, ¿con esa aguja me van a picar? Les digo, no, les van a picar con una chiquitita que no van a sentir nadita. Así es de que pasen a vacunarse. Entonces, lo importante es la creatividad, lo importante es animarlos. Claro que todos lo animamos como promotores, como todo el equipo que estamos trabajando. Y claro que queremos una quebradita por lo menos para bailar con la vacuna.
Muchas gracias a la vegana mexicana. Muchas gracias a ustedes, pero ahora les toca presentar el certificado y vamos a hacer un grupito aquí cerca del póster con la vacuna en el centro. Ahora le vamos a presentar la vacuna de Latino Health Access, el certificado de reconocimiento del congresista y a tomar una foto de grupo. Un aplauso. A ver. Conecte el audio.
Okay, sorry. Yes, real quick.
Y mientras que preparan la cámara, el próximo grupo, si quieren preparar, es Ándale, el último grupo que vamos a presentar. Y tenemos como 15 minutos para la última presentación, entonces más te digo, para anticipar. Y que se vayan preparando.
Can you spread out a little bit so I can see you? Yeah, a little bit. There you go. Maybe. All right, I'm gonna take a couple of them. We got ready for
Muchas gracias. Un aplauso otra vez. Yay. Nuestros amigos de Ándale aquí en Los Ángeles, our friends from Ultimate in Los Angeles are going to come and share their poster presentation. A ver, un aplauso para nuestros amigos de Ultimate. Get one good down.
Hola a todos, hi everyone. So this is a portion of our ultimate field Qué Esperas team. Some of these folks have been with us since last summer, but some of us just kind of joined very recently. My name is Rosa Vasquez. Yeah, met me a little bit earlier. I am currently the campaign lead, leading our on-the-ground efforts.
Oh, you do?
We were originally going to do some introductions, but I think as folks speak, they can introduce themselves. I'm going to try to talk as little as possible to make sure that my team is able to share their knowledge. But I would just give an overview of kind of our campaign, first in English and then in Spanish. So to kind of start off with this poster that Elia is holding, this is a general overview of our campaign. So our campaign focused on 3 main intervention areas. We were focused on outreach, direct services, and community organizing. Instead of necessarily putting on vaccine pods at parks and places, we really focused on building out infrastructure for information delivery. Like what drives people to make the decision to get vaccinated? What barriers are they facing? How do we get information out there? And then how do we connect them to vaccines or to services themselves? Direct services became one of our areas of intervention because we realized that the barriers weren't just like, couldn't be solved by just talking to people. Like the barriers that they were facing were very real and very tangible in their lives. And so it didn't matter if we went out with the best message ever or with the best materials ever, if what people needed at the time were services. Because no matter what you're talking about the vaccine and they're worried about putting food on the table, if there's nothing there that you can say about the vaccine, if that is not their priority. And it's not just about that. I think really it's about honoring the fact that our communities went through trauma through this pandemic, and at the end of it, all they're trying to do is survive. And we're convinced that the vaccine is the key to that. They may not be. And so part of doing community work is honoring what their priorities are over our own. And that's why direct services, although not one of our central, necessarily like intervention areas, is up there as our 3 main ones. And the last one is community organizing. Because I think for us, it was really about going beyond vaccines and more into like, how are we building towards something that can facilitate equitable recovery? Because ultimately, it is the systems that were there before the pandemic that allowed for the pandemic to devastate our communities so widely and so disproportionately. But if we just solve the surface level issues like vaccine disparities or the COVID cases, well, the next pandemic, the next natural disaster is going to disproportionately impact the same areas. So if we talk about building community resiliency and solving for the long term, we need to talk about community organizing and how we're building structure for the community to be able to solve their own issues and not necessarily need organizations to intervene. So that's kind of what our motto is. We're really focused on building longer term community resilience. Okay, en español, rapidito. Aquí tenemos nuestro modelo de la campaña que se enfocaba en 3 áreas. Una era alcance de la comunidad, donde la verdad, donde nos enfocamos en crear sistemas de información, sistemas donde estábamos en la comunidad, no necesariamente con puras vacunas, pero más bien conectando con ellos y tratando de decirles por qué es importante la vacuna y luego conectándolos con appointments. Entonces, la mayoría de nuestro trabajo fue haciendo ese tipo de estructuras donde podíamos ir a las puertas, donde podíamos ir a los eventos y nos pudieran reconocer para que la comunidad mirara que podían confiar en nosotros. La otra parte de nuestra campaña es parte de servicios. Esto no era algo que teníamos al principio, pero mientras que empezamos a hacer alcance
lo que nos enteramos es de que no importa si nosotros tenemos el mejor mensaje, los mejores materiales de todo el mundo, lo que sea, si la comunidad está preocupada por cosas como poner comida en su mesa, no importa qué mensaje tengas tú sobre la vacuna, porque eso no es lo que ellos están preocupados. Entonces, que si de verdad queremos hacer un cambio, tenemos que mirar a la comunidad donde ellos están, y eso quiere decir a lo mejor hacer cambios de tu plan, y eso para nosotros quiso decir poner servicios en el centro, y empezar de ahí, y luego de ahí trabajar al alcance y al convencer a la gente a que se vacune. La otra parte es organizar a la comunidad. Era muy importante para nosotros que los trabajos no se acabara al final de esta campaña, que pudiéramos construir algo, que pudiéramos ayudar a construir algo para que la comunidad se pudiera organizarse cuando hubiera otra pandemia, o si algún día llega, no sé, que haya un terremoto o algo. Las comunidades tienen que tener estructuras, tienen que tener apoyo para poder organizarse. Entonces, por eso, la tercera avenida de la intervención para nosotros fue organizar a la comunidad. Pasar el micrófono a mis compañeros para compartir un par de historias. Quiero compartir un poco de lo que hemos podido hacer. Hemos podido alcanzar más de 350,000 personas en nuestros eventos, tocando puertas, haciendo diferentes cosas así. Hemos tocado más de 13,000 puertas. Tenemos más o menos 35 materiales que hemos hecho y hemos ido a 293 eventos. Aparte, lo que nosotros de verdad queríamos como traer es todos estos servicios, porque aquí está lo de las vacunas, ¿verdad? Conectamos por diferentes partners a más de 53,000 personas. Por nuestra línea directa, ha sido más de 23,000 appointments, pero eso de arriba pudo pasar por todo esto que está acá abajo, de que conectamos a gente a diferentes servicios para que pudieran tener acceso a exámenes de COVID cuando no había exámenes en esta área. Muchas personas hasta estaban saliendo en Los Ángeles que había exámenes que eran falsos, que estaban cobrando a la gente hasta $150 y robándoles toda la información, y al final nunca les mandaban los resultados. Entonces era muy importante que la comunidad tuviera acceso a cosas para mantenerse a salvo. Aparte, muchas personas en la comunidad no tenían acceso ni a clínicas comunitarias. Mucha gente documentada nos decía, ¿cómo es que yo voy a confiar en una clínica si yo he ido a clínicas y me dicen que yo no puedo, que a mí no me pueden dar servicio? Entonces, era muy importante ayudarles a hacer ya los otros appointments con Altamed, que eran gratis durante la pandemia, y aparte también conectarlos a diferentes clínicas comunitarias que nosotros llamábamos y confirmábamos que sí podían ir a todos de la comunidad. Y luego también renta y comida era lo más importante para la gente. Cada vez, si no traíamos servicios sobre renta y sobre comida, la verdad no se podía abrir la puerta porque eso era lo que era central para ellos para sobrevivir. Entonces, un poco de lo que hemos podido hacer, pero ahora le paso el micrófono a Jack.
Hello everyone, can you all hear me? Hopefully yes. My name is Jack and I'm the Community Outreach and Partnerships Coordinator. I kind of led a lot of the activities for outreach, how we kind of like align our activities that we did, kind of like align with how the pandemic was changing over time. So like in the summer of 2021, we kind of just wanted to be present in the community. So that meant like going door to door, just like answering questions to like whatever questions the community had, like what is the vaccine, or how will the vaccine like protect me? And then after that, as the pandemic started changing, we saw, changes, like specifically like the variants, like Delta and Omicron started like rising. So there we kind of worked together and we're like, okay, what does community need? What community needed at the time was testing kits. So we worked with the partner, we were able to secure testing kits. And what we did was kind of like partner up with the local church in Montebello, and we distribute testing kits to the community. And with that, I think one night we did it, we distributed about like 80 testing kits in like a 2-hour time frame. Then after that, the pastor was like very passionate as well, like in doing it again. So he even like asked for us to develop a flyer. He did his own outreach, and then we went in for another time and we distributed another 80 testing kits up again. And then after that, we realized that once the 5 to 11 vaccine started like available, we noticed that a lot of parents were not vaccinating the kids, but also because there was a lot of resources, like, is the vaccine safe for my kid, or like what's like the difference between the 5 to 11 to the adult. So what we did, or like kind of like in the last 3 months, our focus was being out there at the schools during dismissals, answering questions, distributing testing kits. And that's pretty much a summary of like the activities that we did for outreach. So just a summary more aligning our activities in regards to how the pandemic was like changing over time. Yeah.
Lo que está explicando Jackie es cómo nuestro mensaje o nuestras actividades de alcance cambiaron de la pandemia iba cambiando. Al principio empezamos nomás viendo la comunidad lo más que pudiéramos, estando en cada evento que pudiéramos encontrar en Facebook, en Instagram, íbamos a tocar puertas, lo que se podía hacer para que la comunidad mirara que estábamos ahí. No tenían que ir a las clínicas, no tenían que ir a otro lugar, nosotros estábamos donde ellos estaban, pero mientras que la pandemia fue cambiando, diferentes cosas que empezaron a salir, como por ejemplo, faltaba mucha información cuando salieron las vacunas para niños de 5 a 11, no había información en la comunidad, no había recursos que ellos pudieran leer, que ellos pudieran de veras entender. Entonces lo que Jackie ayudó a hacer fue construir una campaña con las escuelas. Empezábamos a hablar a las escuelas, se conectamos a las escuelas para que nos dejaran ir a su escuela a hacer una mesa de información. Y cada vez que las escuelas iban saliendo, ahí estábamos nosotros. O a veces podíamos convencer a los principales a que nos dejaran mandar mensajes por su sistema. Entonces fue de verdad empezar a ser creativos. ¿Qué información se ocupa? Y cómo es que la comunidad ya agarra información y cómo podemos usarlo en vez de crear nuestro propio sistema. Sí, y ahora se lo paso a Felipe para que nos cuente un poco de nuestra...
Hello, my name is Felipe. My name is Felipe. I lead the engagement portion of it, which means that I really hold the ambassador programs here on the Qué Esperas campaign. I held weekly ambassador programs for both youth and community at large from November all the way to now. I'm kind of leading them through different levels of engagement to ensure that we're kind of on a monthly basis, kind of meeting their needs, as well as identifying kind of gaps in what they wanted to learn and build in capacity, as well as kind of inviting them to our events that we had in person and kind of allowing them also space to be able to kind of engage on a deeper level. For example, kind of having them do their own outreach campaigns that they wanted to do for their own communities. Like we mentioned, a lot of our ambassadors were a part of the communities that we were working with, and they would kind of, you know, for example, go on Facebook and really post a flyer so that a lot of folks could come out to the event.
Felipe nos acaba de contar un poco sobre nuestro programa de embajadores comunitarios. Este póster aquí es como lo que salió de nuestros programas donde organizamos a la comunidad. Felipe es la persona que es el líder de los programas de embajadores, donde entrenamos embajadores, ya sea que sean estudiantes de high school, de middle school o adultos, y los vendedores que estamos trabajando, para que ellos puedan ser líderes en lo que estamos haciendo. Entonces, teníamos pláticas donde nos informaban de qué es lo que ellos estaban teniendo como prioridad. Teníamos sesiones donde podíamos como capacitarlos para que ellos pudieran hacer sus propias campañas de alcance. Ellos nos ayudaban a hacer diferentes materiales y luego ellos mismos se iban a WhatsApp y a Facebook y todo para correr la voz. Entonces fue por ese programa de embajadores que la verdad nosotros pudimos centrarnos en que esta campaña no era para nosotros ni de nosotros, era de la comunidad misma. Entonces pudimos entrenar a 371 voluntarios durante la campaña. Tenemos 50 partners digitales, 124 embajadores, de 3 embajadores que son con muchachos. Tuvimos 27 pláticas y aparte tenemos 124 aliados que son como small businesses de la comunidad. Y no nomás es su business de ellos, sino que son ellos mismos como empresarios pequeños de la comunidad, como líderes y como embajadores.
Hi, can everyone hear me? Okay, cool. So hi everyone, my name is Stephanie. I lead the activation part of the coordinating for our program here. And I work really closely with Rosa in getting our Inclusive Action Partnership launched. So just a brief overview, because I know you really want to hear the stories of how we work with our street vendors and things like that. But just a brief overview, we have 50 vendors that we work with on a day-to-day basis. Just a couple of little snippets that we have for our successes is that each ambassador themselves has activated 5 to 6 individuals personally. They have outreach to 30,000 persons per month since we work with them, and they develop 6 new resources alongside, with the ambassadors themselves. And then the ambassadors themselves are also then divided into 4 cohorts.
We're going into the stories. I'll have Rosa translate, and then I'll hand it over to Chris, who will then go into the stories that, we work with our ambassadors and things like that.
Destiny trabaja conmigo para nuestro programa de embajadores que son vendedores ambulantes. Nuestro programa, bueno, aquí está, este póster son todas las fotos de ellos, les hicimos gorros y les dimos camisas y todo. Tenemos 50 embajadores que trabajan con nosotros y trabajan, ellos venden fruta, elotes, hasta los tacos que comieron ahora, ellos trabajan con nosotros. Hay también las personas que hacen las flores y el desayuno. Entonces, hay muchos tipos de vendedores ambulantes con los que trabajamos y nuestra meta era que no quebráramos lo que ellos están haciendo. No era meternos en su trabajo, era más bien, ustedes ya son mensajeros comunitarios. Ustedes ya tienen todo eso. ¿Cómo podemos nomás darles un flyer o algo para que nomás lo pusieran ahí, para que la gente mire que es algo comunitario? Como por ejemplo, a lo mejor miraron que en la troca tenían el flyer que dice, ándale, ¿qué esperas? Lo tienen siempre ahí, para que la gente que venga a comprar tacos tenga oportunidad de agarrar servicios. Entonces, cosas que son notables son que cada vendedor hizo sus propias metas. Entonces, los pusimos en grupos y entre ellos mismos dijeron, nosotros queremos alcanzar 30,000 personas cada mes. Queremos activar a 5 a 6 personas, cada uno de nosotros queremos traer a 5 a 6 personas más. Y aparte, su meta de ellos es a largo plazo crear una comunidad con más equidad. Ellos mismos dijeron, nosotros estamos interesados, sí, en las vacunas, sí, en todo eso, pero queremos más, queremos mejor. Entonces, para nosotros es el programa que de veras nos inspira a seguir haciendo trabajo porque este es el lugar donde hay poder y este es el lugar donde hay tanta esperanza. Entonces, la paso a Cristian para que nos cuente las historias de lo que hemos hecho.
Hello, everybody. My name is Christian. I want to talk a little bit about inclusive action. So I have a story. One of our street vendors, Faustino, I drop flyers often. I speak with them all the time in terms of like how it is working with community. What do you see? What do they ask? And I am constantly inspired by him. I had a particular time where he told me he has a wife from Honduras and her family is trying to like get vaccinations. And he asked me personally, like, how do you do that? And I told him that's more of like a government thing, but he's like, you know what? If you told me to get my Violeta or his bolis, he'll put vaccines and he'll cross the borders of Honduras. If that was a task for him to do, he'd do it. And that like really inspired me to know that like he's doing this on his own time, voluntarily, and like, wow, like I was just really shocked by that. And like that really continues to inspire me and continue to do this type of work.
No puedo traducir. Cristian nos acaba de contar una historia sobre a uno de nuestros vendedores, Faustino, aquí está. Dice que Faustino, su esposa es de Honduras, y hace un tiempo Faustino le preguntó a Cristian que si Cristian sabía un poco de información de cómo agarrar la vacuna en Honduras, porque estaba haciendo muy difícil para también a su esposa. Y que Cristian le dijo, sabes que hay muchas barreras, algo más como del gobierno, o sea, son todas, se trabaja diferente. Y que Faustino le contestó, si tú me preguntas, si tú me dices a mí que agarre mi hielera donde vendo mis bolis y que la llene de vacunas, yo la lleno y yo me voy a Honduras. Entonces, para Cristian fue un momento donde de veras él miró que Faustino no hace el trabajo porque nosotros le dimos un stipend de cualquier dinero, más bien es de su propio corazón y de lo que él quiere para su comunidad. Y no nomás para la comunidad de Estados Unidos, él está pensando en comunidad internacional, ¿verdad? Es algo muy importante para muchos de nosotros aquí. ¿Sí? Ok, ya está. Gracias.
Muchas gracias al equipo de Ándale. Ahora les voy a presentar su certificado y vamos a tomar una foto para conmemorar. Ustedes lo hacen aquí. Next.
Take a couple shots. Smile. You can see your eyes. Ready? Okay, look on a little dark. Here you go. Couple.
We get one more, sorry guys. One more. Perfect. Thank you.
¿Cómo se sienten? Ya, ya vamos a la última porción. Faltan, por ahí, como, vamos a decir, 40 minutos por ahí. Ahora le vamos a pasar el micrófono a nuestra colega Lisette. Now we're going to pass the microphone to our colleague Lisette for the final portion of our. It's been a lot to stick with us for the whole day. You guys are doing a great job. If you guys want a little bit of coffee, water, muffin, a little bit of fruit, feel free to help yourselves. Okay.
Okay, turn that off. Turn that off.
Okay, so I'm not gonna take 40 minutes. I'm gonna try to go through this relatively quickly, because if you're like me, my brain is fading, and your brain is fading as well. And I can't wait to get to dinner. We have something very nice prepared for you all. Yeah, so to breeze through this, and I am at some point gonna hand it off for a couple minutes to one of our partners in this work. So really, this last portion that I have for you all is tying everything together, right? We talked about all the amazing work that you all have been doing, and it's just really, I kept walking to the back because I kept kind of tearing up, because I couldn't believe that, like, we went from something on paper to this, right? And I remember having conversations with some of you, if not with some of your executive directors, being like, are you sure we only have 5 months? And I'm like, listen, that's what Hurst said, and it's, and talking to Loretta and being like, I don't know if we can do this. I don't, and, kind of talking it through with all of you, and then now seeing it here. And knowing that, like, the sleepless nights, right, the everyday, the hustle of this work kind of led to like this tangible campaign effort. For me, was very emotional. And so just thank you to each and every one of you for all of your work. And so what we talked about, though, throughout, that was kind of a trend, right, throughout today, was the disparities that already existed in the community, and how we've already known they were there, but they were really exacerbated, right, through COVID-19, and even through this vaccine work, right? We understood that folks had additional challenges. And so sometimes the breakthrough conversation was saying, was trying to talk to someone about vaccines when they didn't have a job, trying to talk to them about vaccines when they were trying to think about how they're going to put food on the table, right? And these are all things that, have to do with what we've been calling social determinants of health, right? And so the presentation that I had lined up was like a lot of slides, so I'll spare that. But really what I wanted to really circle back on was that the social determinants of health and the power that we have as advocates, organizers, promotores, activists, to bring power back to our communities. You guys are doing it with the vaccines. Now it's time to bring it through the vote, right? And so a couple of things to mention. We actually did an overlay of some of the communities that Ultimate services, because they're underserved communities of color, with where the low propensity Latino voters are. For folks who don't know what low propensity is Latinos who have voted, but not often or frequently, and have only voted in a couple of elections, right? And the density is exactly the same, right? That's where they're at. And then we overlaid that with hard to count census tracts, meaning people that don't traditionally make themselves count in the census. And it was in those same places. So when you look at where we have clear disparities and overlay all of that together, it's very clear that they don't pay attention to us because we don't mean a whole lot for a whole lot of campaigns and candidates, and in many cases, political leaders. And that's just the reality. So how do we harness the power of the infrastructure and work that we created to make it be known that we will hold them accountable, right? Bede talked about, talking to folks in Sacramento, talking to the governor, talking to members of Congress, right? About we need vaccines, we need them now, we need testing. If we had a high voter participation rate, do you think we would have to be demanding these things? Probably not, because they would need us more than they would need us more than we need them, right? And so part of the concept here is reminding ourselves that elected officials work for us. We can seek them and we can unseat them, right? And so we want to take the power of these 100,000, right, that we were able to do together in 11 months, the power of the hiring of these promotores, the activating community, it's interesting because Rosa mentioned something interesting of like the word empowerment, and we were actually in a leadership training where they told us don't use the word of empowering others. You don't hold that power over people, right? All you can do is provide the resources and access. And so providing those resources and access in our communities. And so one of the things that as Ultimate we decided to do is actually launch a civic engagement program. The whole reason why I'm at Ultimate, I actually was working with Naleo Educational Fund for 2 years, worked Mi Familia Vota, ran for office myself. I actually lost by 4 votes. Your vote matters. In a city council race. And so, when I was approached by Ultimate, I was like, why do you want to hire me? I'm not a healthcare person. I'm not, I love community and I'm an organizer, activist at heart. I love civic engagement and I want to see my community voting at 100% is my ultimate life dream, right? And they said, well, because the work that you do impacts the work that we do, right, at Ultimate. And so we now have actually a full civic engagement team, which is all back there. Can my civic engagement team raise your hand? Our focus is, yes, we launched this campaign. We use the same model, and I'll talk a little bit about that in just a bit. But our bread and butter here is turning out Latino voters in our service areas to vote. And one of the key reasons for that as well is that that helps us remind ourselves that the root of community health centers and at the root of Ultimate is social justice work, right? Many years ago, it was actually in Northern California, the Black Panther Party who had mobile units, right? That were providing healthcare to the Black community because they didn't have access, right? And they had these long lines to get that service. In Los Angeles, there was a Barrio Free Clinic that had same thing, right? Mobile unit, Latino community, there were these long lines. But the Barrio Free Clinic today is actually Ultimate. We have 3,000 staff, right? And we have over 400,000 patients throughout LA County and Orange County. But at the core, we were committed and are committed still to providing quality care and access to healthcare for communities who otherwise would not have that, right? And so we can't provide the care if we don't have the conditions to provide that quality and equitable care. And so, in fast forward, 2018, Ultimate launched My Vote, My Health, which is in essence, a get out the vote campaign. We launched it again in 2020. Since then, we were able to turn out thousands and thousands of low propensity Latino voters in all of our service areas. In addition to that, our CEO was committed to use every single one of our community health centers as civic engagement hubs. What does that mean? That means that when I go to get my checkup, when I go to get my vaccine, when I go see Dr. Shapiro, right, and I'm waiting in the waiting area, I get messages around voting. I get messages about participating in the census. And so that folks see it as a thing that you do that determines your health, right? You get a checkup, you get your vaccinations, and you register and you vote if you're eligible, right? And all those conditions will help you overall with your health, right? Your actual, and there's a lot of studies, right, on social determinants of health and how there is only a certain percentage that is actually determined by the healthcare you receive, and the other portion is by the communities you live in. And so many of us were born and raised in those communities, and so by default, we're already in a space where we're going to have to breathe air that doesn't help us. We're going to have to be in polluted areas, polluted water, etc. So again, all of that for us at Ultimate goes back to the core of civic engagement. We got to speak up, right? And you change all that again through government and elections. And so we're relaunching our My Vote, My Health again this year because what's coming up? Does anyone know what's coming up in June?
Primary.
Yeah, primary election, June 7th, right? We're going to elect the candidates that are going to go up for key races all across the state. Why does that matter, right? And a lot of folks will, we always get this, right, in family when you start talking about you should vote, they're like, no me gusta la política. It's not politics, it's your health, right? And taking us in this journey of social determinants is your health, it's the health of your children, it's the health of your family. And so that was kind of the concept, right, that we had behind that. Now, when we elect the top candidates in the primary to face each other off, we have the power out of a pool of 12, I think in the LA mayoral race is about 12, to select who are the top 2 that are going to run off against each other in November. In some congressional races, you know, Latino Health Access in San Isidro, you'll have some of the most competitive congressional races. In your cases, it will determine how the entire Congress looks like and whether we can pass legislation, laws at the federal level that will help or hurt our community. We're experiencing it now, right? Roe versus Wade, like, my vote doesn't really matter. Well, it does, because you saw what happened when a certain president was elected and had access to Supreme Court nominations, right? And so we want to see this as a thing that we do. Civic engagement is part of healthcare, right? And so for My Vote, My Health efforts, we're again launching this work. We're going to have toolkits, posters. Half of the work that we've been doing these past 2 weeks, that's why I have my ojeda, is developing all of our assets for that work. So we'll have t-shirts, the My Vote, My Health t-shirts. We'll have door hangers that explain the social determinants of health to the community. Remind them when the voter registration deadline is, remind them when elections are, remind them that they can vote early, right? You don't want to go to the polls, you can vote by mail, and you can vote early at a vote center. And we'll have handouts, we'll have tabletops. All of our computers actually at Ultimate will have screensavers with the dates, with a QR code. And so we're going to make that available to you all, so that if you want to, if you say, listen, yes, we agree, it's important, we're a small team, we're asked to do a lot, right? Then by all means use our stuff. We're spending a lot of hours on it. So please use our stuff. Just because it's extremely important that we communicate this to the community. The other reason why is that poll after poll and survey after survey has shown us that amongst the most trusted messengers for Latinos are healthcare professionals over teachers, right? That was the work that I used to do at NALEO. I used to do a lot of the presentations for all of our research findings nationally, and doctors and nurses were always rated up on top. And I remember at NALEO thinking, how do we get to the nurses and doctors? Like, that's who we need, right? And now I'm in the space where I have access to nurses and doctors, right? And so, you know, again, this work is very critical. The other piece here, and a lot of what I had was actually like government 101, but I think we could do this in a webinar too. You guys have received a lot of information today, so we'll do a follow-up webinar for folks who are interested. But in addition to you know, all of the congressional races, right? We usually only hear about elections when it's like a president, right? And like, okay, it's a November election, it's every 4 years. Every 2 years are actually every midterm election is when we have the most important elections. That's when you elect real leaders who are going to impact, not real leaders, but leaders that are going to impact your work directly. Does anyone know what redistricting is? I know it's a very nerdy concept, but raise your hand if you know what redistricting is. Who knows that we just went through the redistricting process? Okay. So what redistricting is every 10 years, we take a census, right? Remember the census? Based off of that, there's this whole process that happens in California to determine how the congressional districts will look, how the assembly. So whether your representative will stay your representative or will you get a new representative because you now belong to a new district. That's a very important process, but what ends up happening is that we now have an opportunity to reshift how leadership looks in our state and in our counties. For the very first time in a very long time in Orange County, we have a majority Latino supervisorial district, right? So we have the conditions by which we can create power for our communities and give them the voice that they desperately need to ensure that we close those gaps around health disparities. And for us, we believe that through advocacy, through making sure that we're constantly at the table in those public hearings and through elections, we can make that happen. And so again, instead of my 40-minute presentation, I wanted to do a few minutes of a call to action in hopes that you all will join us in our My Vote, My Health campaign, which is Mi Voto, Mi Salud. We're actually launching next week. We're in LA County and Orange County, we're targeting 200,000 low propensity and new Latino voters around all of our service area. We've cut the turf. We're hosting a candidate town hall on virtual and radio town hall. So we took the best practices, right? With all of the mayoral, with the top 5 mayoral candidates in Los Angeles, because in Los Angeles, even though Latinos are the majority, we're actually not in a lot of appointed leadership. So we need to make sure that we're present. And so whoever's interested, come to me, come to my civic engagement team, and we're happy to partner with you all. Again, we'll follow up with a webinar that really takes us through the principles of government and advocacy, as well as get out the vote. The one quick statement is that all of our efforts are C3 compliant and they're nonpartisan. We don't tell people who to vote for. We just tell them the importance of voting and we give them all the tools and information. And so, it's been interesting because we're now, Ultimate is now part of the National Civic Health Alliance, where we kind of come in and say, here's what we're doing at our clinic, right? And what we always hear is that a lot of clinics, a lot of healthcare providers are often scared because they feel like that's some political space or boundary that they shouldn't be crossing. But the only way that they can make their communities healthy is if they make sure that their communities are voting. And so we've been playing a role at the national level on making sure that community health centers and the trainings that we're doing are actually for community health centers in Georgia, Florida, Arizona, Michigan, North Carolina, and California. We're just taking this model and basically what I just said in presentation form to all of these clinics, because we need to empower communities of color and Latinos to be present at the table and to be healthier by way of making sure that we have policies and access to healthcare equity in the way that they deserve. That's my spiel, not 40 minutes. Hopefully that was helpful and hopefully we'll get folks on board. I did want to give a couple of minutes to our friends at San Isidro Health, which we're really excited because we've been partnering with San Isidro Health 2018-2020 to do this work. And when I learned of Alejandra's title, that had a civic engagement title, I was like, oh yeah, they have a civic engagement. I was really excited. And so I did also want to give her a couple of minutes to kind of share the work that San Isidro Health is doing. You all heard my spiel. After Alejandra shares some of their experiences, I'll close this out and hopefully we can break bread together for dinner. So Alejandra, come on over.
Hi, everyone. I know I'm the one standing between dinner and the fun dinner part and you sitting down, so I'll make it really brief. So My name is Alejandra Perez, and I'm the External Affairs Manager with San Isidro Health, and I've been with the organization for about 2.5 years. And when I first started with San Isidro Health, I pretty much was given the task and the project of the My Vote My Health. I was given this project within the first week, and I ran with it. So similarly to what with that mention with the Ándale, Qué Esperas campaign, I was so excited because I'm incredibly passionate about advocacy and ensuring that our communities have access and are informed on what impacts their lives. So when we're talking about education and advocacy and outreach, that's a two-pronged approach with Ándale, Qué Esperas, My Vote, My Health campaign, because the work that we have been doing with the COVID-19 outreach efforts with Ándale, Qué Esperas, it's the same with the My Vote, My Health. We had to do that not only internally, but externally, because we also had to engage and educate our providers, our colleagues, our staff, and our community also. And by the way that we did that is that we were able to encourage and really ensure that our own providers were able to go out into the community to share with the community how important it was to vote for them. And for those folks that have not voted in 5+ years as well. So these are individuals who already were enrolled to vote, that maybe went when they were 18 and registered to vote, that have not voted. And it was similarly to what you have all mentioned when it comes to folks who weren't getting vaccinated. Why was it? It was because no one has talked to them. No one has told them the impact that their vote makes. No one has taken the time to tell them how important their vote is. So similarly, again, to COVID-19 and the vaccination, that is what we were doing at San Isidro Health. We were really wanting to ensure that we were encouraging our own staff, walking on the weekends, walking at after hours. We're able to get residents who were working at our clinics wearing the white coat and go door knocking and let folks know, hi, my name is Dr. So-and-so. I'm here from San Isidro Health from My Vote My Health campaign, and we would love for you to vote. Not only answering their questions about their health in general, but letting them know that ultimately their vote was going to impact and influence their health outcomes, not only for themselves, their family, their children, but their community as a whole. Additionally, we were able to ensure that we were promoting using social media, making sure that whenever we were out in communities, we were letting folks know that it was really important to vote, and also letting them know key dates. Oftentimes it's about not knowing where is the easiest access vote center for folks. So making sure that they were able to do that. So it's as easy as that. So the work that the promotores are doing out in the community, it's incredibly simple for voting and engaging individuals to be educated on that front. We were able to have, thanks to Ultimate, all the fabulous collateral that they were able to put together, as far as being able to have our display monitors in our clinics when people were waiting. We were able to go ahead and read about why it was important to ensure that they were voting with the QR codes as well. And then also being able to make calls to individuals that were low propensity voters that were identified as well. So it's an incredibly easy way to get engaged, to stay active, to ensure that we're getting our community united in lieu together making a difference for the community. So we're really excited that Ultimate approached us back in 2019 to be a part of that campaign. And we continue to promote it, and we continue to share the importance of voting, because ultimately, as a tagline that I learned while doing the My Vote My Health campaign, was tu vida depende en tu voto. Like, your life depends on it.
A lot of opportunities for folks to do this work. Again, folks have any question, or if folks individually want to volunteer, we're open to that too. For us, we're actually doing door knocking, phones, phone canvassing and peer-to-peer texting. So any modality that you want to contact people, we have it for you. With that, Octavio, do you have any announcements before? Okay, so I'll end my portion. thank you everyone for all of your work, for coming out with us, for indulging us. Thank you to Octavio. Work would be possible without him, without our friends and Dimitris who are in the back, who, you know, every time. I would automatically get a call from John and be like, I have a better idea. I'd be like, tell me, John. Our friends at, right? Yes, he gave me a bunch of ideas as I walked back over there to the restroom. Our friends at OSU, shout out to them. As our evaluation and reporting partners, but I was just really amazed to see their true vested interest in making sure that you all had the capacity, the tools, everything you all needed to do this work, really going above and beyond. Last but not least, LCHC. And to Robert. I think LCHC was the first folks we approached and we're like, you know, can we do this? And I remember Jeff and Cecia kind of being very chill about it and being like, yeah, I think we can. And you guys made me feel at peace, we could pull it off. So, you know, thank you all for it. But again, thank you to everyone. It's been great. I will see everyone at dinner. And without further ado, I'll hand it over to Octavio for announcements. Thanks, everyone.
This would not be possible. Ok, solo unos cuantos mensajes para acabar. Primeramente, los que vinieron en el camión está afuera y listo para llevarnos a la party, a la cena. For those of you who came on the shuttle bus, the bus is outside out front. And it's going to take you to the restaurant, Don Chentes. And don't worry, the restaurant is going to be very, very casual. We have DJs from Chita Vinyl Club spinning for us. It's going to be a lot of fun. And then when you get there, they'll explain how drinks work and how food's going to work also. But it's going to be a lot of fun. There's no more business happening at dinner. So that's number one. So if you came on the shuttle, si vinieron en el camión está afuera. Les vamos a dar 10 minutos para que agarren sus cosas y se saluden, se despidan, y luego al camión. The shuttle bus will go also from, los que vinieron en el camión va a ir de Chentes. ¿Escuchan? ¿Me escuchan? ¿Me escuchan? El camión va a ir de Don Chente. I have to turn on the teacher voice there for a second. Okay. El camión va a ir de Don Chente al hotel. ¿A qué hora saldrán? ¿Qué dijimos? 5:30. No, del restaurante al hotel.
Ya 5:30. Porque usa las 6:50.
Ah, ¿cuándo se las ven? No les vas a decir.
Ya. 5:30.
Ah, perfecto. Ok. Entonces, los que se vinieron en el camión, no se preocupen, el camión va a ir del restaurante para atrás al hotel para recoger cosas. If you came on the bus will go from the restaurant to the hotel at the end of the evening. Last item is John over here in the hat is going to be capturing some sound bites. Last sound bites from one representative, the point person for every clinic. He's going to come meet John in the back for some sound bites. Y por último, la última cosa, los voy a invitar todos acá enfrente a tomarnos una foto de familia. The AQB familia acá enfrente. We'll take a group photo before we all head out. Entonces los invito a que se paren, se estiren las piernas, los brazos, los chaparritos enfrente, los chaparritos acá arriba, los altos enfrente. Ah, usted. ¿Cómo se dice? Ok, vamos a tomar una foto en familia, entonces les voy a pedir que todos se vengan para acá enfrente, hacia mí. Vamos a tomar de acá arriba para abajo.
Oh, it's gonna be facing down. Huh? Oh, facing down.
Ok, vamos a tomar una foto. Todos se pueden venir. Ultimate team, you guys can come forward and do a big group shot with everyone together. Nuestros amigos de la clínica. Ok, todos vamos a ver aquí al fotógrafo. We're all gonna look at the photographer over here. Okay. All right, if you guys can't see the lens can't see you. Si no pueden ver el lente de la cámara no los va a ver a ustedes, ¿ok? Ahorita me bajo. Ahorita me bajo. Ok. Si los de atrás, nuestros amigos de Ultimate, you guys are hiding behind the tallest people. Perfect. Perfect. Esta foto va a ser histórica. And then folks in the back. All right, behind Rosa, we see someone hiding behind you. There we go. Yay. And then way in the back, you step forward. Yeah, perfect. John, you're in the photo. You're gonna have to leave.
Take several shots, so just stay there and keep smiling, okay? On the side, just like. Everybody smile, here we go, 1, 2, 3. Keep going. Keep going. Keep going. Yes.